Uh, Hi all, I am Dr. AARATHY from Drona. I will be discussing the 2025 question paper with some of the points which will help you to attend the exam a little more easier. So moving on to the question paper, the first question of 2025 was, if there is Kabhanabandha in Vadaja Gulma, then Eranda Taila should be given along with which of the following? That was the first question. So in that case, the options given were Varuni Mandam, Godugdam, Utpala Kwadam, Gomutram, right? So just by seeing the options itself, you can eliminate two of them. Which are they? They are Godugda and Utpala Kwada because it is said Kabhanabandha in Vadaja Gulma, right? So these two options can be eliminated on seeing the options itself. So from four options, you will come down, you will reduce it to two options, whereas Varuni Manda and Gomukta. These are the two options that you will be having a little doubt with. Actually, this is a direct question where in Drona notes you have the answer as such. So for as far as Gulma is concerned, you will have to be thorough with the types. For that matter, any KC disease, you will have to be very thorough with the types of the disease, the Nidana Panchaka for that matter. And then when it comes to Chigilsa, the Chigilsa Sutra is very important. And specific conditions, when mentioned, they are also to be understood and studied very thoroughly. Okay. So for Gulma, there are a few quotations mentioned. For few quotes which are like Ada Vandecha Madhyecha Marutam Parirakshata, Basti Karma Param Vidya, Gulmagnam Tadhi Marutam, then Agni Sadam Rakshet, Nidanani Cha Varjayet. So these are a few quotations which have been given in Gulma Chigilsa, which actually is very confusing with other diseases like Grahani, Raktapittam, Vadaraktam, and all. Because in Vadaraktam also there is something related to Marutam. In Grahani, if you take Agni is very important. So Agni related codes will be there also. So keep in mind that you have to study these, put small connections, make small connections with Gulma, all these codes, and study it. Okay. So that next thing is treatment according to sthana in Gulma. Like Urdhva Nabija Gulma should be treated with Snehapana, while Pakwashya Gata Gulma with Vasti and Jadavashya Gulma, Ubhaya Chikilsa is done. So that point is important. The same way, there is another point in Vadiga Gulma Chikilsa, like Punaha Punaha Snehapanam, Niruhamsa Anuvasanam. So similar quotations is given in Grahani, Kushtam, etc., which can give you confusions. So one important whenever you start studying is to maintain a confusion book. Like you will get, especially in Ayurveda, you have so many opinions for one particular thing. There are three or four acharyas giving three or four opinions, and it's quite difficult to memorize everything, right? When it is one or two concepts, it's okay, but then when it comes to more than a heap of concepts, then taking so many opinions is very difficult. So for to make a little more easier, your studies a little more easier, it is better that you compile those things in one single place so that last minute reading will be very comfortable for you. Okay. So this I won't be giving all those exact points here. I'll just guide you so that you can go check with the other topics and write down the confusion points. Okay, that is a small homework for you. Okay, so punaha snehapanam niroham sa anuvasanam prayojyo vada gulmeshu kabha pitta anurakshina. This quote is given in Vadiga Gulma. Similar quotes are given in Grahani Chikilsa, Kushta Chikilsa, etc. Go find it out and write it in one place. Okay. The next comes the conditions where Vada Anubandha Sleshma. Eranda Taila with Prasanna is given as per Ashtanga Hridaya, but with Varuni Vanda, Eranda Taila is given according to Charaga. This is the question asked. Then Anubandha Pitta, Eranda Taila with Kshira. That's a little more, connectable, like Pitta, Kshira. Vada Gulma with Hrillasa Gaurava Tantra, Vamana. So Hrillasam, Gauravam, Tandra, all these are Kaba predominant. So in those cases, usually Vamana is done. That way you can connect it. Vada Kabha Gulma with Shula Anaha Vibanda. Nadi Prastara Sankara Svedam mentioned by Charaga, while Bhakti Guliga Churna is mentioned by Ashtanga Hridaya. Charaga also says Bhakti Guliga and Churna. So that point is important. You may note it down or mark it down. Then Vada Gulma with Pitta and Sandava. Sasneha Anulomanam is said. So these conditions are very important. Since one question has come from here, there are more chances that you get questions from these nearby areas. So kindly note it down. That coming to Pitta Gulma Chikilsa, if it is Ruksha Ushna Nidana, then Shamana with Sarpi is indicated, while Snigdha Ushna Nidana, Shramsana is done. You can connect it as when it is Ruksham and Ushnam. Obviously, it will be Sati, which can counteract these two gunas, right? Then Snigdha Ushna Nidana, then Shramsana is done. It is Paitiga Gulma, so Shramsana has a good role. Then Pitta Gulma in Pakvashya, Tikta Kshira Vasti is done. Then Gulma with Trishna, Jwara, Paridhana, Shula, Sweda, Agni Mardava, and Aruchi. In that case, Rakta Mokshana is done. So that is Agni Mardava is there. Agni is, deteriorated. So in that case, Krishna, Jwara, all these things are present. So Rakta Mokshana is good. And there comes another quote over there, Chinna Mule Vidahyante na Gulma Yanti Chukshaya. So all these quotes, it is already asked in 2017 AAPGT. So please note down all these quotes. Now, if Gulma is Paga, then Pitta Vidridi Chigilsa is done. Coming on to Kabaja Gulma. So naturally, Kabha, Vamana is the Chigilsa. If Avamya, then Upavasa is mentioned. Langhanam is the word mentioned by Charaga, while Upavasa is mentioned by Ashtanga Hridaya. Then Stanad Apasradam Kabhajam Gulmam Virejaye Tadha Dashamulikam Vasti. So, Kritamulam, Mahavastam, Kadhinam, Stimitam, Guru. These are the conditions in Kabaja Gulma where Kshara, Arishta, and Agnikarma are indicated. So those conditions are very important. Please note it down. Then, na shamam yadi, rakta mokshana with daha karma. If there is no shamana with all these things, then obviously rakta mokshana with daha karma is indicated. Then gulma mardhana is indicated with ghadi yantra. So these are the most important cream points of gulma chikitsa. You have to, at any cost, understand and study these points along with the other points in the notes. Now, moving on to the second question, which combination, that is Sandhi, is in the word Hridyaushidam? The answer is Vriddhi Sandhi and Yana Sandhi. Both are present. I hope all of you are aware with Maheshwara Sutram. Ayunaralag, Ayong, Ayauch, Hayavarata, Lana, right? So if you're not familiar with those, please do study it so that you may get few easier questions also from Sanskrit part in relation with Maheshwara Sutra. So now, eco energy is the first sandhi. So the sutram is eco energy, which means in any word, two words combined to form a sandhi, right? So there is a purva padam and there is a para padam. Okay. So in purva padam, in eco energy, what happens is how the sandhi happens is the purva padam may end with e or e or u or u, r or r. That is ik pratyaharam. Okay, e I un r r. So ik pratyaharam is formed with e u r r. So the purva padam will be ending with any of these, and parapadam starts with any swara, preferably a or a. Okay, so in such cases, when e is the ending part of purva padam and the parapadam starts with a swara, that it is replaced or the sandhi happens by replacing this with ya. The same way, if the purva pada ends with u or u and the parapada starts with swara, the sandhi happens by replacing it with v. When it is r, then it is replaced with r. And when it is r, it is replaced with l. This is what eco energy says. So E is replaced. E, when you say E, the E also comes with it. So E or E, then it is replaced with ear. Yana pratyahara. So ear, v, r, l is the yana pratyahara. Ik pratyahara is E, U, r, r. So respectively, E with ear, U with v, r with r, and l with l. This is how it is replaced. I'll give you a few examples so that it is more clear for you. Now, for the first part, that is E with replaced with year, et plus aha. Et ends with e, right? And aha is a second or parapadam, which starts with a swara or a, which is replaced with year, and the word becomes ityaha. Iti plus aha becomes ityaha. The same way, prati plus ekaha. Prati plus ekaha. Prati ends with e, and uh, ekaha, which means it starts with a. Parapadam starts with a or a swara. So these two combine, and the sandhi is replaced with what? Ya. So it is pratyekaha. Prati plus ekaha. Pratyekaha. Then yadi plus api. Yadyapi. Yadi plus api. Yadyapi. So these are the examples for first part. The second one, u or u. Purvapadam ending with u or u, and the sandhi being replaced with verb. Okay. Guru plus Ajna. Guru, U. U sound comes for the Purva Padam. It ends with U sound, and Ajna, which means it starts with a Swara, right? So in that case, it is Gurvajna. Ver, it is replaced with ver. So Gurvajna. Now the next one is Madhu plus Ari. Madhu plus Ari, Madhvari. Madhu plus Ari, Madhvari. For the third part, R, Matra plus Ajna. Matra, tr, R. It ends with R, and Ajna, the Parapadam, starts with A. So it becomes Matrajna because it is replaced with R. Okay. The same way it is Pitra. Pitra plus A, Pitra. Now, Lakriti. Lakriti, how is it? This is a sandhi after the sandhi. It is Lakriti. So before the sandhi, it is Lr plus Akriti. Lr plus Akriti. So it ends with the Purva Padam ends with Lr, and Parapadam starts with A. So it is Lakriti. Okay. So this is about eco energy. The second one sandhi mentioned over there is Vriddhi sandhi. Vriddhi sandhi, the sutram is Vriddhi Rechi. Vriddhi Rechi. So Vriddhi Rechi means the Purva Padam ends with A or A, and the Parapadam can start with A, I, O, Au. Okay. If the Parapadam starts with A or I, the sandhi is replaced by, or the sandhi is formed by replacing with I. And if it is the Parapadam starts with O or Au, the sandhi is formed by replacing it with Au. This is how the sandhi goes. The Vriddhi sandhi, Vriddhi Reji, H pratyay. Okay, H pratyay. So the Purva Padam ends with A or A, and the Parapadam can start with A or I, where it is replaced by I. If it starts with O or Au, it is replaced by Au. This is what Vriddhi Sandhi mentions. So I'll give you examples so that you can uh, get it cleared. Okay, Sadha Eva. Sada Eva, which means the Purva Padam ends with A, and the Parapadam starts with A, right? So when these join together, the Sandhi forms by replacing with I, right? So the word becomes Sadaiva. Sadaiva. Dhana Aishwaryam. Dhana Aishwaryam. But Dhana, which means it ends in A, Dhana. Aishwaryam starts with, the next word starts with I. And when you replace this, the sandhi forms by replacing with I, Dhanaishwaryam, Dhanaishwaryam. Same way, other examples are Devaishwaryam, where Deva plus Aishwaryam, Devaishwaryam. Same way, the second part, like Danta plus Oshta, Danta plus Oshta, Danta, it ends with A, and Oshta starts with O. It is replaced while forming Sandhi with Au. Danta Oshta. It is converted to Danta Oshta. Okay. Um, so I'll give you some more examples. You can work it out. Putreshana, Putreshana, Putra plus Eshana, Putreshana. Param plus Aishwaryam, Paramaishwaryam. Tadha plus Eva, Tadha plus Eva, Tadhaiva. Vidya plus Aishwaryam, Vidya Aishwaryam. Vana plus Aushadhi, Vanaushadhi. Maha plus Oja, Mahauja. Maha plus Aushadhi, Mahaushadhi. So these are the examples for Riddhi Sandhi. Kindly work it out, understand, and make a clear idea of what Purvapadam and Parapadam ends and starts with, so that you can replace with what. If you study these 3 points, the Sandhi will be very easier. Then the third Sandhi mentioned is Ayadi Sandhi. The sutram is Echo Ayavayavaha. Echo Ayavayavaha. So the Purva Padam will be ending with H Pratyaharam. H Pratyaharam means A, I, O, and O. That is the H Pratyahara. When the Purva Pada ends with A or I, the conversion is the conversion will be like I, Av, I, Av. That is how it is converted, which means when the Purvapada ends with A and the Parapada starts with a Swara, okay? A plus Swara, then it is replaced with I. When it is O plus Swara, it is Av. When it is I plus Swara, it is I. And when it is Av plus Swara, it is Av. That is called Echo Ayavayavaha. Aya, Av, Aya, Av. Okay, so A means it is replaced. So the condition is that Purva Padam ends with A, I, O, Av, and Parapadam starts with a Swara. In that case, if it is A plus Swara, it is I. It is O plus Swara, then it is Av. If it is I plus Swara, it is I. It is Av plus Swara, then it is Av. Okay, there's a small mistake. Here it is shown like Aya and Ava. You have to add Aya and Ava also. Okay, so I'll give you a few examples. Ne plus Anam. Ne means the word ends with A and the next word starts with Anam, Swaram, Swaram, right? So this two forms a Sandhi as Nayanam, because Ne plus Anam, that A is replaced with Aya. So Na Ayanam, Na Ayanam, Nayanam. Okay, the same way, Bho plus Anam, Bho plus Anam, which means it should be replaced with Ava because it is O, right? So Ava, Bhavanam, Bho plus Anam, Bhavanam. Then Ga, Gav plus Gai plus Ak. Gai plus Ak means it is replaced with I, which means Gayak, Gayak. Same way, Bhav plus Ak, which is Bhavak. Bhavak is replaced with Av. Similar examples are Kava, Kavaye, Haraye, Shayanam. Okay. Then Nayak, um, Pavan. Pavan, when you split it, it is Po plus An. Po plus An, which is replaced with Av. So Pavan. Okay. Pavan. All these are examples for Ayadi Sandhi. The next one is Guna Sandhi. Guna Sandhi is the sutram is Ad Gunaha. Ad Gunaha, which is the condition is like Sandhi se Purva means Purva Padam is before the Sandhi, the Purva Padam should end with a or a, and the Parapadam will start with E, U, R, R, R. E, U, R, R. These four. E, when I say E, it includes E, E. When I say U, it includes U, U. Okay. So any of these ik pratyaharam will be the starting of the Parapadam, and the Purvapadam ends with a or a. In that case, Sandhi ke baad or after the Sandhi, what happens is, if it is E, then it is replaced with A. If it is O, it is replaced with O. And if it is R, it is replaced with R. And if it is R, it is replaced with Al. So this is what Guna Sandhi says. So I'll give you some examples so that you can be a little more, clear about it. The first one, Nara plus Indra. Nara plus Indra. What happens? Nara, it ends with A, right? Indra, it starts with E. So after the Sandhi, it is replaced with A, right? So it will be Narendra, Narendra, Devendra, Gajendra, Mahendra. All these have Guna Sandhi. Okay? Purnendu, Purna plus Indu, Purnendu. Na plus iti, na plus iti, neti. Okay. So the second one, where Purva Padam ends in a or a, and Parapadam starts with u or u. The examples are Maha plus Udaya, Mahodaya. Maha plus Udaya, Mahodaya. Surya plus Ushma, Suryoshma. Saha plus Udara, Sahodara. Prashna plus Uttar, Prashnotar. Okay. So the third one, where Purvapadam ends with a or a, and Parapadam starts with r. In that case, the Sandhi is attained by replacing it with ar. Examples for that: Deva plus Rishi, Devarshi. Sapta plus Rishi, Saptarshi. Maha plus Rishi, Maharshi. All these, it is replaced with ar. So with Ragaram, it is not so common, but still I'll give you one or two examples so that you have an idea about it. Mama plus Ragaraha. Mama plus Ragara forms Mamalkara because it is replaced with Al, right? Mama, it ends with A. Ragara starts with R, so it is replaced with Al. It becomes Mamalkara. Same way, it is Tavalkara, Ramalkara. All these are Al. Okay, so Guna Sandhi stands like this. I hope you have got it. The third question is chromosomal syndromes and the patterns. So this is very important. You will have to study all these symptoms. In pediatrics, you will be studying in detail the symptoms also for each of these syndromes. Okay. So Patau's is trisomy 13, Edwards is trisomy 18, and Turner's is 45X, Klinefelter's is 47XXY. The options are as such given, right? So option A is the correct answer. So Down syndrome, as I said, it is trisomy 21. So normally human cells contain 23 pairs of chromosomes, where Downs results when this 21st chromosome has an abnormal cell division. And it becomes 3 chromosomes in 21. Okay, 3 copies of 21. Extra partial or full chromosome 21 is a result. That results in Down syndrome. So there will be total 47 chromosomes in Downs. Then Edwards, it is trisomy 18. Patau, it is trisomy 13. And Turner's, it is 45X, which means one X is missing. So you need to understand the Turner's occurs in females. It affects only the females where one X is missing, and it results when it is partially or completely missing. Okay. Then Klinefelter syndrome, it is 47XXY, which occurs in males actually, So that is an extra X in those people where the chromosome pattern would be 47XXY. Then Cry-do-Chat syndrome, it is 5p minus syndrome. That is deletion of the chromosome 5. That is what Cry-do-Chat syndrome says. Okay. The fourth question is Navametu खलु एनं मासे मधुरौषधसिद्धेन तैलेन अनुवासेत्. So the 9th month regimen of Garbhini according to each Acharya. That is what the question is. So this is explained in detail in Prasudi. So you need to study. I'm not going to explain each and every point in this because you already have the notes. I suppose you have all gone through all these things. You have studied these. So I am here to just let you know where all you will have to concentrate in such topics. Okay. So usually we all will go through these antenatal care month-wise dietetics and all. Where we miss is the highlighted portions, like the matras are mentioned specifically for the 4th month. And as per Charaga, you have specific matras mentioned in 4th month as Aksha Matram. 6th month it is Panidala Matram. 7th month also it is Panidala Matram. And Kshira Yavagu Paingalyam. There is an assertion reason over there. So all these points you will have to note down. And obviously you will have to study the whole thing. I don't know if you have any codes for that, but still it is very easy to study Charakacharya's opinion because it goes in in a uniform manner. Coming to Sushruta, we will be studying all the main points, but where we miss is Jangala Mamsam is first given in 4th month. Please note down that. There it is Paya Navanita Jangala Mamsavat Pradya Udana. And another thing we might miss is the Anyamata of Shashtiga Udanam. From 3rd month to 6th month, they have insisted to give Shashtika Udanam with different Anupanas, right? So in 3rd month it is pious, then 4th month it is Dadi, 5th month again pious, and 6th month it is Sarpi or Yavago. So make it like pious, Dadi, pious, Sarpi or Yavago, so that you have that order with you. Okay. Then coming to Harida, it is also important. You can, note that from 2nd month it is said, not from the 1st month. So don't miss that point. From 2nd month it is Kagoli with pious. 3rd month it is Krishara. 4th month it is Krutodana. 5th month Payasa. 6th month Maduram Dati. 7th month Grita Ganda. And 8th month Grita Puraga. So note down all these points. And along with that, another important point is the Basti schedule mentioned by different acharyas. So we said Jangala Mamsam is given in 4th month by Sushruta, but while coming to Ashtanga Hridaya, Mamsarasam or Mamsa Odanam, Rasodanam is mentioned only in 9th month. So there is one confusion point over there, right? The same way, another thing is in Ashtanga Hridaya, Anuvasanam is done with Gridam, Madhura Aushada Siddha Gridam, while Sushruta says Anuvasana with Taila. So these are a few small confusion points which might miss your notice. So these are the points where you will have to concentrate more, and you have to write it down separately. Keep it handy so that last minute preparations can be much more easier. Okay, so note down which Kashaya is set for Niruha by Ashtanga Hridaya and Sushruta, and which is set for Anvasana, and which month Anvasanavasti is done, which month Astavanavasti is done. All those points are very important. Like Charaga has mentioned only 9th month Vasti, right? In 9th month, he has said Anvasana to be done, and also Piju with the same Taila is advised. While Sushruta advises Astavana and Anuvasana in 8th month itself, morning Astavana and Sai Anuvasana. Astavana is done with Badarodagam and Anuvasana with Madhuraushada Siddha Tailam. Well, Ashtanga Hridayam says Astapanam with Shushka Mula Kashayam in 8th month and Anuvasanam with Madhuraushada Siddha Gritham in 8th month. And 9th month, it is Anuvasana with the same medicines. That is Madhuraushada Siddha Gritham. While coming to Kashyapa says if there is any ailments, then you can do Astapana or Anuvasana by the 5th month in Garbhini. While Bhela advises Kadamba Masha Tailena Anuvasanam in 9th month. So these are the important points where regarding Vasti in Garbhini. So note those down. And uh, Bhela's 5th month regimen, that is Shira Yavagu, has been asked in 2021. So make sure you go through those regimen also, because we might skip some of these points, with some like not so important acharyas, but as far as last year's, that is 2025's exam is concerned, it's not like any particular topic has so much importance and some topics have no importance. No, the questions have been coming from all over. Okay, so please see that you give equal importance, more or less equal importance to all those points. Coming to the fifth question, it is regarding the dosage of Grita by Kashyapa for Jadamatra. There is a table given. So Jadamatra, it is Kolasti. 20th night, it is Kola Ardha. 1 month, it is Kola. 3 months, it is Drikola. 4 months, it is Shushka Amalaga. And 5th and 6th month, it is Ardra Amalaga. It follows a pattern, right? Kolasti means a seed of Kola fruit. Then Kola Ardha, half of the fruit. Then Kola, 1 Kola fruit. Then 3rd month, it is Drikola, 2 fruits of Kola. And 4th month, it is Shushka Amalaga. 5th and 6th month, it is Ardra Amalaga, right? You can imagine, I don't know whether you have codes for this, but if you don't have, you can just imagine. It is like the size keeps on increasing. Okay. So when you study this Grida dosage, do give, uh, do give importance to other doses, like mentioned by Kashyapa and Sharangadara, and also the modern dosages like Clark's rule, Fried's rule, Dilling's rule, Cowling's rule, all those things. You will have to go through that also. Those are very important. When you study those, make sure you note down whether it is regarding the weight, whether it is calculated with the weight of the child. If the weight, if it is in pounds or kg, if it is in months, that is age wise, if whether the age is calculated in months or years, all those minute points have to be noted. Okay. Coming to the 6th question, the most powerful research design for establishing causal relationship between exposure and outcome. So, to establish a causal relationship, which means you're establishing something, which means you are very sure about it, right? Make sure you need proof, right? So, uh, uh, here the question is, you're establishing a causal relationship. So, generally, the studies, research is divided into two elaborate ones. One is observational study and the other one is experimental study. Observational study, as the name suggests, you just observe things and you come to a conclusion. While in experimental studies, you do in observational studies, you don't interfere with anything. Any sort of interference you cannot do in observational studies. But in experimental studies, uh, an interference right from lifestyle modification till a surgery or a medicine or a panchakarma procedure, any sort of intervention accounts for experimental studies. Okay, so experimental studies mainly it is observational studies are divided into two, which are analytical and descriptive studies, while experimental studies are, different types, are of different types, like RCT, which is randomized controlled trials or clinical trials. They can be non-randomized or non-experimental trials. They can be field trials, community trials. So there are so many types of trials. You need not go very deep into it, but then you have to understand the essence of what is told. So what is randomized controlled trials? Randomized controlled trial is nothing but you have a controlled clinical research. Like you have two groups, minimum of two groups, where one will be your test group, the other will be a control group. You can have more than two groups also. And an intervention is given where one group receives your intervention, the other group might receive a standard procedure or standard treatment or a placebo as per the condition. And you analyze or you take up the research, you collect the data, and then you analyze and compare. So that is how randomized clinical trials work. And in RCTs, uh, the steps involved in RCTs, now the next year you will be passing out the entrance exam, you will get into different colleges, and the one big thing you're going to face is you have to do a thesis work, right? So when it comes to your study, the first thing you're supposed to do is you need to have a plan of your study, right? That is called a protocol. So drawing up a protocol is a first step in your study. Then once you have drawn up the protocol, once you have made sure that how your study is going to go, you have an outline of that, then the next thing is you're actually going to conduct a study. For that purpose, you will need your experimental population and the reference population. So selecting the reference and experimental population is the second step. Now, how will you select them? Through randomization. What is randomization? Without any bias, you will be allotting people or patients to your study groups. Like, for example, let us take that I'm conducting a study to prove my drug is effective in diabetes. Okay, I have a group of population where a few are highly diabetic and few are borderline diabetic, a few are moderately diabetic. So if I can choose the participants in two ways. Either I can, with bias, what can I do? I can take all those, minimally diabetic people or pre-diabetic people into my study drug group, and I can put the highly diabetic group into a standard treatment protocol group, right? A control group. So that what happens? My drug will have more effect, right? A pre-diabetic, you know, um, group of population might receive my drug so that it shows a little more improvement, right? Is that a valid study? No, right? Your research doesn't have a credibility, right? You cannot say that your drug is actually effective. So for that matter, what should we do? We need to randomize the selection. We should not have any bias while selecting. That process of selection of people or uh, subjects into your study without any bias is called randomization. Okay, I hope you understood it. So, intervention, you will study how the randomized selection happens, how the sampling happens, all those things you will be studying a little more detail in research. Now, the next, once you have allocated the participants, the next one is what you will give your intervention, right? You will give your intervention, then you will take up the follow-up and then assess the results. So this is how the steps of RCT goes. So randomization is the heart of RCT, and the purpose of randomization is to eliminate bias. So, a few more terms in research is what reference or target population. What do you mean by reference or target population? I said I'm going to do a study in diabetes, right? So, once if I have my drug proved effective in diabetes, so who is going to benefit from it? The diabetic people in the population, in the general population, right? So as per my research, my reference population or my target population is all the diabetic people out there because I have done my research in diabetes, right? So what is the experimental or study population? Experimental or study population is those group of people who have actually taken part in my study. Okay, but it doesn't mean that I'm doing a research in diabetes. It doesn't mean that I'm giving my drug to all the diabetic people out there, right? No, I cannot do that. It is not practically feasible. So I'll be selecting a small portion from my area and then I'll give them the drug and I will extrapolate the results into the whole population. So my target population will be all the diabetic people out there in the population. while my experimental or study population are the actual people who took part in my study. Okay. Now, the other word is blinding. Blinding is actually done to eliminate bias. What does blinding mean? Literally, the word meaning is, tying your eyes. You say it is, you are blindfold, right? So that is what is happening here. It can be of three types. Like it can be single blind, where the researcher might know which drug is going to which participant, while the participant would not know as to what drug they are taking, which means they wouldn't know if they are into the trial group or the actual research group or in the placebo or standard group. They might not know that. This is called single blind. Well, double blind means neither the researcher nor the patient knows as to what medicine they are taking. Suppose I am doing the research, I will be having my guide or a higher person who looks after or who supervises my research, right? So he might be knowing which group is having which medicine, but I wouldn't know, and the same way my research participants wouldn't know which medicine they are taking. So that is what double blind is. Now, what is triple blind? Triple blind means both the researcher and the participant don't know what they're taking. And also the analyzer who analyzes the results, they also don't know what is going to which person. Okay. So this is how it is: single blind, double blind, and triple blind. Now, coming to non-random. So until now, we were talking about randomized controlled trials. I said experimental studies can be RCTs, non-randomized trials also can be there, right? Non-randomized trials means uncontrolled trials or natural experiments or before and after comparison studies. Uncontrolled trials, which means there are no comparison groups. We said in RCTs, there will be a comparator group or a control group. In uncontrolled trials, you won't have a control group. Okay. All the participants of your study will receive the one intervention you're giving, or the intervention which you are supposed to study is being given to all the participants of the study. That is called uncontrolled trials. There is no control group. Now, natural experiment. Natural experiment means the researcher do not have any control on the environment or the study setting, or what to say. For example, when I say an example, you will get to know. You don't have a control on epidemics or natural calamities, right? For example, you're studying the life after a natural calamity or a flood or something like that. Okay, a tsunami or a flood. You're studying the life or the effect of that natural calamity. So you never have that control on the intervention. Here, the intervention is the natural calamity, which the researcher never has a control on it, right? Such natural interventions come under natural experiments. So the researcher do not have any control on the intervention, but he can only, take account of the results and analyze it. That is called natural experiment. Now, before and after comparison studies. Before and after comparison study means the same group is studied before the intervention, then the intervention is given, and then later on after the intervention also we'll take the parameters and then we'll compare the before and after parameters. So those are called before and after comparison studies. Okay, the same group acts as the control of themselves. That is what this before and after comparison studies offer. So non-randomized trials can be uncontrolled trials, natural experiments, before and after comparison studies. Now, this can be without a control group or with a natural control group. Okay, these studies can be without control groups or with a natural control group. Then other type is concurrent or parallel study design. Concurrent means concurrent. What does it mean? Currently, you're watching or you're assessing the interventions for more than two or more groups at the same time with different interventions for each group. That is what concurrent says. That is, you may have 3 or 4 groups. Like let us take the example of diabetes itself. I have 3 set of people or 4 set of people. Let me say 4 set of people. One group receives my drug of study. The second group might receive a standard drug like metformin or so. The third group might receive a placebo. The fourth group will be receiving another drug. Okay, so I have 4 groups at the same time. Four groups receive 4 different interventions, and I'm comparing all those 4 groups, the results at the same time. That's called concurrent design. Now, parallel design, it is a form of concurrent design itself, where each person gets only one treatment, and the results of one group is compared with the other group. Okay, somewhat similar to concurrent design itself. Now, crossover study design means the same group of people are given 2 separate interventions with a gap in between. Okay, and then the results of both the interventions are compared. For example, now I have 2 pain balms. Okay, I want to know which pain balm is good. So what I'll do, I'll take a group of people, and I'll give my first pain balm. Okay, I'll ask them to use. So for a particular period of time, then I'll give them a resting period. Okay, say for example, 1 week they used my first pain balm number 1, and then 2 weeks I've given them rest, and later on, the next week I'm giving them the pain balm 2, and I'm asking them to use it for a week. And now I'm collecting the results of the first week and the last week. Okay, I have already collected for the first week. Now for the last week also I'm collecting, and then I'm comparing the results. So this is crossover study design, where the interventions are given to the same group of people and compared. Okay, and the in between, resting period is called the washout period. Okay, so this is how crossover study design happens. I hope that these much points are clear for you. Now we're moving on to the 7th question. This is a direct question. What all rasayana are indicated in Kabaja Hridroga? So the answer is Shilajatu Rasayana and Amalaki Rasayana. It's a direct question. You have your notes, and those are mentioned. As I said, whenever you take a disease, please do, take a small paper, write down the types of all the diseases together. Then important rupa, important clinical features. If at all there are important clinical features, you can make it, together. Then coming to the treatment part, Chigilsa Sutras of all KC diseases should be kept together. All these are to be done, during this time, because you have umpteen time now. You might have finished once or twice, you might have finished all the portions by now. So now, from now on, you have 5 more months, almost 4 to 5 months, right? So now it is your time to revise things, right? So you have already studied things, I suppose. So in that case, what you should do is, whenever you start studying, keep a few papers with you. So that one should be, whenever you study KC, the things you have to have is a confusion book, wherein you have to write the confusion points, which I've mentioned before. You'll get umpteen confusion points whenever you study. So try to note them down together. And the second one is for KC specifically, types should be noted down for each disease. Then if you have any important nidanas, or any sort of clinical features which are very particular to that also you can note it down separately. Important yogas can be noted, and you have to have that idea that whenever a yoga is asked, if at all, it is from which pradharana. So that should be answered, right? So that's the easiest question regarding yoga. From which pradharana is this yoga is taken? One such question is the 7th one. So you can make a note of important yogas for each disease separately. Then ubadravas of rogas. For certain rogas, there are ubadrava lakshanas, right? Those you can, tabulate, or you can write it separately. Same way, important, very, very important quotes from each disease. You can just note them down so that, once you study all those KC diseases, the notes, the quotes especially shouldn't confuse you. Words like Agni, Vadam, all these things, Vasti, these come, over and above for almost all the diseases. And mainly like Grahani, Gulma, all these keep you, Udaram, all these keep you very much confusing. So make sure that you write it separately. Okay. So I've given the important points. Like Sivadiga, Hridroga, Tailam Saviraka, Mastu Takram, Varuni Mandam is indicated. And here, one important thing to be noted is Edani eva varjyani hridrogeshu chaturshu abhi. This is one quote said by Ashtanga Hridaya. Please note it down and mark what this Edani eva indicates. Okay, Kshiram, Dadi, Guda, Sarpi, Odaga, Anuva, Amasham. That you should know. Then Paitiga Hridroga, Kabaja Hridroga, you have Rasayana preparations indicated, and that is what the question is. You have Kanmada Rasayana or Shilajadu Rasayana, Chavana Prasham, Agastya Haridagi, Amalaki Rasayana, Brahma Rasayana, etc. Ksharas are also mentioned. Like in Kabaja Gulma, you have Shara, Agada, etc. All those Ksharas can be used in Kabaja Hridroga also. In Paitiga Hridroga, Chigilsa, usually you don't use Mahisha Sarpi, right? But in Paitiga Hridroga, Aushada Siddha Mahisha Sarpi is used. That one point you may note. Then Balatailam sa Hridroga Pibet va Sukumaragam Yashyahu Saptaham va Mahasneham Tadottamam. So Balatailam is mentioned, Sukumaragam, then Yashyahu Tailam, Shadavaga Tailam, all these Mahasneham are mentioned in Hridroga. Okay. To note down these points. As far as KC is concerned, you cannot study KC by just reading it one or two times. You may have to repeat it every now and then. So all you have to do is make a timetable of yourself, give half an hour daily for KC alone, keep reading one after the other. Just half an hour reading daily. Where, end it at the 30th minute. Wherever you reach, end it by the 30th minute over there. Then restart it the next day. So every day when you have that touch, going forward, after 1 or 2 months, you may actually, keep aside a few diseases that you will be very thorough with. So you can reduce the number of diseases that way. So keep on reading, only then you will get KC. Okay, KC is one such volatile subject, and the other one is Shalakyam. It is very much volatile than any other subject, actually. Okay, so the next question is from Shalakya. According to Ashtanga Hridaya, which of the following clinical feature is suggestive of involvement of first tuneal layer in Shataja Shukra? So first layer, right? Shataja Shukra, you have 3 layers. Like first layer it is Krishram, second layer it is Yapim, and third layer it is Asadhyam. And first layer it is specifically mentioned as Pakwa Jambu Nibam. Second layer it is Suji Vidhavam, right? And third layer it is Nichitam Branaihi. Okay, so please note down that. And also the Chikilsa is very important for that. Trivrit Grita, Trifala Prayogam, Tiktagagridam, Lekhana Anjanam, Jadi Muguladi Varti, then Dantavarti, Tamala Patradi Guliga, Ratnadi Guliga, all these are mentioned in Shataja Shukra. Note down the Asadya Lakshanas also. The 9th question, which of the following Arishta Lakshanas of pregnant woman is not told by Kashyapa as an indication for instrumental delivery of fetus? So, which is the context? Mudagarbha is the context. And Kashyapa has said a few, symptoms where the Shastra karma is indicated in Garbhini. Okay, so if at all the Garbhini has a desire to eat flesh of Mayura, that is peacock, that is what is said, but the option given is flesh of horse. That is why it became wrong. Okay, the shlokas depict the symptoms. Nasatu kagavat yasyaha srasta netra cha ya bhavet tata shagunda gandha cha garbha shastrena uchyate. So 3 points over there. Nasatu Kagavat. One. Second one, Srastha Netram. Third one, Shakunda Gandha. Then the next two lines, Aja Ashwagandham Shvetam va Mayura Mamsamichati. Aja Ashwagandham. Aja Ashwagandham. Same way, Mayura Mamsamichati. Garbhastasya Shastreena Narya Nirhriyate Nirpa. So, in total, 5 conditions are mentioned. Nasatu Kagavat, Srastanetra, Shakundagandha, Aja Ashwagandha, and Mayura Mamsa Vichati. Okay, so note these down. Then, given below are two statements. Next question. Statement 1, according to Charaga, if the pregnant lady consumes hot, pungent dravyas after the stabilization of fetus in 4th month, it may cause bleeding or discharge per vagina. Can you identify the context? It is Ubhavishtaka Nagodara Garbha Vyapat, right? Ubhavishtaka Nagodara Lina Garbha context. So it is well said that according to Charaga, 4th month, which means Sanjada Sare, Ushna Tikshna Upayogam. What happens? You have Rakta Darshanam, Pushpa Darshanam, right? It is as such said in the shloka. So it is a direct statement, which is correct. The second one states according to Vagbadha. So the first one was according to Charaka. The second one is according to Vagbadha. If the pregnant lady suffers from discharge or bleeding per vagina, so this can lead to improper growth of fetus, and sometimes fetus does not grow but cures with an extended stay of fetus. So this is also said by Vagbada, right? Vagbada also mentions these symptoms in Upavishtakam. So as you have to study all those conditions, and there are a lot of confusion points in that topic. I'll let you know where you will get confusions so that you can go check and write all those confusion points. Okay. There are some 7 points where you have a lot of confusions. The first and foremost one is names. Names mentioned by different acharyas for different conditions. That is a point of confusion. The second one is Spurana. For each, you have to note down for which condition Spurana is said, which condition there is no Spurana, where Acharya has not mentioned anything about Spurana, all those things. The third one is regarding stay of fetus. Okay, extended stay is mentioned in some of them. In some of them, it is not mentioned. So that one is a point of confusion. The fourth one is Nidanam of each condition, like Upavishtagat Nidanam, Nagodram's Nidanam, right? All those are also a point of confusion. So note them also together. Then the next one is a reason, like for Upavishtakam, it is Ushna Tikshna Upayogam. While for Vadabibanna Garbha or Garbha Shosham, it is like Garbhini doesn't take enough ahara, right? So each has its own nidana. So you have to, or the reason, it has its own reason. So you will have to note that also down. Then Kukshi and Garbha Vriddhi also has different opinions, right? That point also is a confusion point. Then regarding treatment also, you have a little confusion over there. Means confusion matlab, each acharya might have said a little different treatment for each. So that is also one point of confusion. So I have told 7 points where confusions exist in this one topic. You will have to make a note of each point for each acharya. You tabulate it and maintain it so that last minute reading will be easy. Okay. Now the next question, 11th one is, according to Sushruta, consider two statements as given below. Ojas is a Sara of Shukra, and statement 2, Sandhi Vislesha is the feature of Ojakshaya. So Ojas is one very important topic. You can find references in Ashtanga Hridayam 13, Charaka, I suppose it is 26 or 27, I think. Do refer it. I don't remember the correct chapter. So all these combined, you can, Sushruta also, you have 21st chapter, I guess, Sutram 21st chapter or so. So you will have all those references in one place. If you have global text, you can get the reference, all these references together. Please do refer the global text so that not only the characteristic features of ojas, like some say it is Ishad Lohita Pidagam, some give it as Sarpivarnam, Madhurasam, Laja Gandhi, right? All these are confusion statements. You have to note down all these statements. And also, along with that, Ojak Shaya, Oja Vyapat is mentioned, right? Ojo Shaya, Ojo Vistram, Samojo Vyapat, and all is also mentioned. You have to note it down that also. And here the first statement is Oja is said as a Sara of Shukra, right? So some say it's as Sara of Shukra, some as Ubadatu, some as Mala, right? There is a point of difference in that also. So that is also given in global text in Kriya Shariram section, I guess. You can go and refer it and make a note of it. Okay. Now, the second statement, Sandhi Vislesha, is said in Oja Kshaya. No, it is not said in Oja Kshaya. It is said in Ojo Visramsa, right? So, this Ojo Visramsa or Sandhi Vislesha is said in Ojo Visramsa as well as Sleshma Vriddhi too. Sleshma Vriddhi is, it comes under the Dosha Dhatu Mala Kshaya Vriddhi Lakshanas, right? So Sleshma Vriddhi and Ojo Visramsa both show the feature of Sandhi Vislesham. The same way, Gatranam Sadanam is seen in Ojo Visramsa, also in Mamsa Kshaya. So you have another confusion point here, right? So note this down. And also, when I say this, Dosha Dhatu Mala Vriddhi Kshaya Lakshanas are very confusing. You have a lot of confusion points coming in that topic. Please do, refer each acharya, note down what all confusion points are being said over there. Also, regarding ojas, please note down the points of Dalhana, Chakrapani, etc. Like, those acharyas also. Main acharyas we might note, but we might miss this things. So please do note that also. Okay. Who says ojas as Bala? All these things are very important. Okay. Then a 12th question, as per Sushruta, the characteristic of surgical intervention for Prachana Karma is. Sushrutam Sutram, 14th chapter. You have all the references over there. 14th chapter. So, Prachana Karmam, how should you do Prachana Karmam? Riju, Asankirnam, Sukshmam, Samam, Anavagadam, Anuttanam, Ashu. These are the characteristic features of Prachana Karma. This is how Shastram should be, Shastra Padaram should be done during Prachana Karma. It should be Riju, straight. It should be Asankirnam, not very complicated. It should be Sukshmam, very minute or very precise. Then Samam, in a proper Sama manner. Then Anavagadam, not so deep. Anuttanam, not so, it shouldn't be very deep. It shouldn't be very superficial also. Okay. So these are the characteristic features of Prachana. So the option Anuttanam is the answer. Samam, Anavagadam, Anuthanam, Ashu. Ashu is also mentioned. Ashu means it should be very fast, right? Okay. Now, the next one is you might note the indications of Jalauka, Siravyadam, then Shringa Alabu, Prachanam, etc. given in that chapter also itself. Please do note that is Avagadam, Grathidam, you use Jalauka, while Pindidam, Egadesham, it is Prachanam. Anga Vyavagam, it is Siravyadhanam, and Twakstidam, it is Shringa Alabu. So please note those also. Now, 13th question, it is regarding Guna. I'm sure everyone would be very much, pretty much thorough with this Guna topic, right? So I think not very necessary to go through it. One thing I would like to say is, please do, 1 second. Yeah, sorry. Please note down the classification of gunas. One thing is that is very important. like Atma Guna, Vaisheshika Guna, Guruvadi Guna, Paradi Guna, all these are very important. And along with that, in Guruvadi Guna, there are a few, difference of opinion regarding Manda Tikshna, Mridu Tikshna, Manda Saras, Lakshna Karkasha, right? You have the table and those are highlighted also. Do have a note of that, difference of opinions. And another very important thing is the Panchabautika constitution of each guna and the definition of each guna given by Hematri. These are very important. When you study guna, do not miss these points in Gurvati Guna. It is very important. As far as Panchabautika constitution is considered, do try answering yourself. For example, when you think about Guru, Prithvi and Jala are to come and Guru, right? Check if your logic works out. If your logic works out, then fine. If it doesn't work out, please note it, relate it in some way, and then study. Please do not sit and study all those 20. Instead, work out your logic. If your logic is good enough to answer the question, then leave that aside. Whichever logic doesn't work, please give a connection to the guna and then you can study. Okay, because it's not very practically possible to keep on studying all these things. There are a lot of things to study. And also take note of extra gunas mentioned, like Vyavai, Vikashya, Shukari, Karkasha, all those extra gunas mentioned. Also, you will have to go through, just have a read, understand what it means. Now, going to the 14th question, it is an assertion reason type question. When I say about assertion reason question, as I said about confusion book, it is very good if you can maintain an assertion reason book, at least for those, the points which are actually given as assertion reason. For example, here in Adoga Rektavitta and Urdhoga Rektavitta, or the Sadhya Sadhita of Rektavitta, Sadhya Sadhita of Rektavitta, Sadhya Sadhita of Prameha, all these are actually Acharya himself has given the assertion and reason, right? The reason for these things. So those are, sure short questions. You have a clear opinion about these reasonings. So you do not want to miss those direct questions. It is better you keep a small note for that. Whenever you study, keep the note aside. When you get to, when you come across those things, just note it down. That's it. That is what you need. It would be very much easier for you to, if you compile it initially itself. Okay. So as far as Rektapitta is concerned, Adoga Rektapitta is Yapya because it is Vamana Sadhya, right? And Madhura Aushada Sadhya or Aushada, Alpa Aushada, right? Those are the reasons given, right? So here the statement says it is Yapya because Virechana cannot be administered here. When you think logically, you might feel that yes, Virechana cannot be administered there. So that might be the reason it is Yapya because we know Adoga Rektabita is Yapya. In that moment when you are in the exam hall, you might think yes, this is fine. The reason is far logically correct. But then Acharya has crystal clearly given the reason as Vamana Sadhyatvat, Alpa Ushadhatvat. So only those reasons come into action. Okay. So that is why the statement 1 went incorrect. And the statement 2, this is the reason mentioned over Urduga Rektavitta is Sadhya because it is Virejana Sadhya and it is more number of Aushadas are mentioned in that. So that is how the second statement is correct, but the first statement became wrong because the reason given is Vamana Sadhyatvat and Alpa Aushadhatvat, not Virejana Asadhyatvat. Okay, so that is the difference. This shows the importance of the actual phrases mentioned in the shloka. Okay, so in Rektapitta, there are, there might be confusions when you study about the conditions or the Tarpanadi Kramam and the Samsarjana Krama, etc., mentioned by Charaga and Ashtanga Hridaya, etc. All those things can, confuse you. So make a clear note of each point in that. Also, Sandarpanota, Apadarpanota, Rektapitta, how they are treated, and what kind of Rekta Mokshana procedure is done. All those points are very important along with the yogas. Now, 15th question, amlodipine, mefenamic acid, codeine, and montelukast. A few, medicines are very familiar. Might be a few wouldn't be so familiar. Okay, so here amlodipine comes under BP medication, right? So it is a calcium channel blocker actually. So generally, in general, BB medications are classified into few groups. Like one is diuretics. As the name suggests, the action diuretics is to remove the sodium and water by the kidneys. The second group of BB medication belongs to ACE inhibitors. ACE inhibitors means angiotensin 2 receptor blockers. So angiotensin 2 receptor is an enzyme which narrows the blood vessels. Okay, so when you block this enzyme, what happens? The narrowing of blood vessels do not happen, so that it is a little more open and the BP reduces. That is how ACE inhibitors, act. Now, the third group is beta blockers. Beta blockers, they act by slowing down the heart rate, reducing the force of the heartbeat, and then lowering the BP. That is how they lower the BP. The fourth group is calcium channel blockers. Calcium channel blockers, what happens when calcium enters into the blood vessels? It constricts the blood vessels. So, this calcium channel blockers, what do? They block the channel and prevent calcium from entering the blood vessels so that the blood vessels don't constrict. Okay, so calcium from muscle cells will enter, the blood vessels and make them constrict. This calcium channel blockers prevent this pathway so that the blood vessels are not constricted. And as a result, BP is lowered. So, amlodipine comes under this calcium channel blockers. Apart from these, there are other groups also, BP reducing medicines like alpha blockers, central agonists, vasodilators, direct renin inhibitors, etc. are also few more groups of BP medications. Okay. So we'll move on to the next one, mefenamic acid. Mefenamic acid, I'm very sure that most of you have been, you might have heard of ibuprofen. One of the other cases, you might have had these medicines, like they are NSAIDs, that is anti-inflammatory and analgesics, right? They belong to those groups, NSAIDs. So very popular ones are ibuprofen, meftalspas, all these ones. Their action is analgesic and anti-inflammatory. It is commonly used in pain-related conditions or inflammatory conditions like dysmenorrhea, etc. The action is they inhibit the cyclooxygenase enzymes. 1 and 2, cyclooxygenase enzymes. What is the role of cyclooxygenase? They convert the arachidonic acid into prostaglandins. Prostaglandins cause pain and inflammation in the body. So these, by blocking the cyclooxygenase enzymes, the release of prostaglandins is inhibited so that there is no pain and inflammation. Okay, so that is how these, mefenamic acid acts. Then the next group is codeine. Next group mentioned is codeine. Codeine, it is an opioid analgesic, or it is an analgesic group. Analgesics are mainly opioid and non-opioid derivatives. Codeine is an opioid analgesic, and the action of codeine is mainly antitussive. Antitussive means it is cough suppressing. It is bronchodilation happens, and the cough is the dry, irritating cough is suppressed. Okay, mainly codeine is used in dry, irritating, non-productive cough. The mechanism, as I said, it suppresses the cough center and medulla of brain. Okay, cough center in medulla of brain. Now, the next group is montelukast. Montelukast, next drug, it belongs to the class leukotriene receptor antagonist. The mechanism is it prevents CysLT1 receptor. CysLT1 receptor, cystine leukotriene receptor 1. Okay, it prevents this receptor, which mediates bronchoconstriction and inflammation. So once this receptor comes into action, bronchoconstriction occurs and inflammation occurs. So this montelukast, what it does, it prevents this cis-LT1 receptor so that bronchoconstriction doesn't happen. For the previous one, codeine, it acts in the medulla of brain. Okay. For montelukast, it acts in the bronchioles or bronchi of the body, lungs. Now, indication is asthma, allergic rhinitis, etc. More related to respiratory ailments. So it is like cystine leukotriene receptor is found in lungs and airways. These receptors bind leukotrienes. When the leukotrienes bind to cis-LT1 receptors, they cause bronchoconstriction, airway inflammation, mucus secretion, and airway edema. So as a result, when you take montelukast, this whole cycle is blocked and you don't have that bronchoconstriction. Okay, airway clearance happens. Now, the next question, another name of Sudhanidhi Rasa is Rasa Pushpam, Mugdha Rasa, Siddha Magaradhwaj, and Rasa Karpura. The name is Rasa Pushpam. So, Rasa Pushpam, Rasa Sumam, Kusumam, Rasa Pushpagam, all these are synonyms of Sudhanidhi Rasa. Then preparation, Vishuddha Bharata, Lavana, that is Saindhava Lavana, and Shuddha Kasisa. All these are taken 5 tola each. The preparation is done with Vishuddha Bharata, Saindhava Lavana, and Shuddha Kasisam taken 5 tola each. And the guna is also mentioned. It is Pittaharam, Mutralam, Vrana Doshahrit, Param Virejanagaram, Taya Bhuta Vishabham, Swaragaranam, Atyantam, Jaliyamsham, Vishoshanam. So it cures Vishujiga, Krimi, Hikka, Bhirangam, Jalodaram, etc. Then the Matra portion is very important. For Shishu Virejana, it is half rati, while normal adult Virejana, it is 2.5 rati. Firanga Roga, it is 1/4 rati dosage. General Matra is 0.5 to 2.5 rati. So the Matra is very important. Also, please go through the ingredients and this synonyms. Okay. Now the next question is, choose a correct option for regression line passing through the origin. So what is regression analysis in statistics? Regression analysis means nothing but studying the relationship between the independent variable and the dependent variable. Okay. How the independent variable, change in the independent variable can change the dependent variable. That is the regression analysis. That the study of that part is called regression analysis. And there is a formula, a general form of regression line, which is y is equal to a plus bx. So we do not need so much in-depth understanding of these things as far as AIPGT is concerned. You need only basic things. Sometimes a little in-depth questions like this come, but that is not very common. It's very rare. Okay, so my suggestion would be, do study the basic ones thoroughly and then move on. If you have time, you can move on to in-depth study. Okay, now as far as this question is concerned, you need to know the general form of regression line. Only then you will get the answer. So general form of regression line is y is equal to a plus bx, where a is the intercept, or rather the meaning of intercept is when x or the independent variable has a value of 0, y or the dependent variable will have some value, right? That value is called intercept. Okay, A. And B is the regression coefficient. B is called the regression coefficient. So now in the question it is asked, choose the correct option for regression line passing through the origin. Origin means x and y have the value 0, right? So origin means that the point where x-axis and y-axis meet is called the origin, where x value is 0, y value is also 0. So in that case, general form of regression line is y is equal to a plus bx, substituting the values of origin, that is values of y and x in the equation. You'll get 0 is equal to a plus b into 0. Right from that equation, you can come to a conclusion that the value of the intercept will be 0 because y is already 0. B into 0 is again 0, right? Now, A is equal to y is the equation. Y value is 0, so that A is also 0. So the option is intercept is 0. The regression coefficient is, the other options are correlation is 0, regression coefficient is 0, dependent variable y is 0. So, regression line passing through the origin, and the most correct option is intercept is 0. Just understand this question alone. I don't think you will be needing a lot, into the question. Correlation is 0. Why it is that option doesn't come? Because if correlation is 0, which it means there is no linear relationship. That is, it is not related to the origin. If correlation is 0, then the origin point is not related to this. Regression coefficient is 0, the line becomes horizontal and it won't be through the origin. It might be somewhere in the y-axis, not through the origin. Then dependent variable y is 0, which means y is 0 only at the origin and not for all the values. So, in this case, only intercept is 0 will be the right answer. So correlation, I'll just let you know what is correlation. Correlation is a statistical measure that shows the degree and direction of a relationship between two variables. That is, independent variable X and dependent variable Y, how they are related and how much degree of relationship is there in between them. Even if I explain this now, you might not be understanding anything. Might be only the sentence meaning you will get to know, and it is not needed also. Just to make sure I'm giving you the definitions alone. And regression coefficient, the regression coefficient measures the change in the dependent variable for 1 unit change in the independent variable. That is, if you change the independent variable by 1 unit, how much ever change occurs in the dependent variable is the regression coefficient. Okay. So for example, 1 unit of change in independent variable is made, then you will have some sort of change in the dependent variable and you measure that and that will be your regression coefficient. And the formula for simple regression is change in y by change in x. So dependent variable is a variable whose value changes depending upon the independent variable. Independent variable means the intervention or the exposure. Whatever intervention or exposure is being given or done to the, research or the variables is called, how would I say? Okay, let me explain it like this. I am giving a kashayam or a medicine for diabetes. Okay, whatever medicine or the kashayam or the guliga I am giving for diabetes is my intervention or the independent variable, and diabetes is the dependent variable. I think now you'll be a little more clear about it. So the dependent variable is the value which gets changed through our intervention. And the intervention we give is the independent variable. Okay. Just understand those things. That is enough. And 18th question, how many types of nidra has been described by Ashtanga Sangraha? It is very much direct question. So you can find 7 types of nidra in Ashtanga Sangraham, while 6 in Ashtanga Hridayam. Okay. 6 mentioned by Charaka also, and 3 mentioned by Sushruta. Do note down the different types of nidra. Now the next question is, according to Ashtanga Hridaya, Malsya Gandhi Bhavet Pakwaha Mamsa Shatanaha. This feature is related to which one of the following disease? The answer is Alasa. It is very much direct. As far as Shalak is concerned, specifically Shalakim 2, you need to first In the first round, you need to study about the dosha predominance of each disease. Then the second round, when you're thorough with that, go for a second round wherein you study about the important similes, features of each roga. Okay, you can make a separate note for each of these. Take a paper, write all the Shalakya rogas with their dosha predominances, specifically Sushruta and Ashtanga Hridaya opinions should be noted. Okay, the second round, you take another paper, write all the similes. Okay, so these two are very, very important as far as Mukharoga is concerned. Also, not only Mukharoga, but generally in Shalakya. For Mukharoga, especially, there are a lot of similes which you will get confused. So, if you are intending to, leave Mukharoga without studying, please do not leave it completely. At least go through the dosha predominance and the similes. Okay. Mhm. Then the next question is, according to Charaka, which of the following disease Vamana is indicated? So indications and contraindications of Vamana, Virejana, Vastya, Stabana, Anuvasana, Vasti, Nastya, all these are very important. You need to study each and every indication and contraindication regarding Panchakarma. Okay, that was a direct question. If you have studied shlokas of any of the acharyas, do study those shlokas and just compare what all diseases are not being mentioned in but mentioned in other acharyas context. Okay, so do a comparative study. It is more easy. If you have codes, it is well and good. If you can change these shlokas into small songs of your language, it'll be a little more easier. Who are comfortable with songs, it will be easier for them. You can study either in that way, or you can study the shlokas and then compare with other acharyas and take the extra points alone, note down the extra points alone. You have difference of opinions of, for example, in Hridroga, Vamana is indicated only by Sushruta and Sharangadhara, but others have contraindicated. So that's how you have a lot of difference of opinion in these topics. So either convert it into songs or give other connections, put some codes so that you remember it easily. Else you will have to mug up. Okay. So somehow you will have to study it because it is very, very important. Not only Vamana, but for that matter, all the Panchakarma procedures. The indications and contraindications are very important. Okay. Then, 21st question, which of the following are included in Chadushpragara Samshuddhi? Chadushpragara Samshuddhi means you don't have Anuvasana. All the others are there, right? Shirovirejana, Raktamokshana, Niruhavasti and Vamana present. Sorry, Shirovirejanam, Niruhavasti and Vamana are present according to Charaka, Chadushprakara Samshuddhi. Okay, Raktamokshana is not there. Charaka doesn't mention Raktamokshana, right? So the four Chadushprakara Samshuddhi according to Charaka is Vamana Virejana, Niruhavasti and Shirovirejana. Anuvasana is not mentioned in Samshuddhi. And the 22nd question, which of the following is correct supplementary nutrition for children of 6 to 72 months through integrated mother and child ICDS scheme? It is 12 to 15 grams per day protein and 500 kilocalories per day energy. That is the answer. So do read about ICDS scheme, the year it was established, and the for children from 6 to 72 months. Normal children, this 500 kilocalories per day with 12 to 15 grams of protein. While if it is severely malnourished children of 6 to 72 months, then 800 kilocalories is the energy requirement, while 20 to 50 grams of protein should be given. And for pregnant women and nursing mothers, it is 600 kilocalories per day of energy and 18 to 20 gram of protein is needed. Note down these points. 23rd question. See the following two statements of Acharya Charaka. Snehapana is contraindicated during Nasya and Vastikarma. Statement 2 indicates in snake bite, Uttama Matra of Snehapana is indicated. So coming back to Panchakarma, indications and contraindications. I said about Vamana, you got a question from Vamana Virejana just a few questions back, right? Now again for Snehapana, Nasya and Vasti. Snehapana indications and contraindications is another question. So you can imagine the importance of the topic. Sneha, Sweda, Vamana, Virejana, Astapana, Anuvasana, Nasya, Dhumapana. All these indications and contraindications are very important as far as Sneha Matra is considered. You will have to understand or study about the Pradhana, Madhyama, and Avara Matra or Hina Matra. What is indicated according to Charaga, like Pradhana Matra, whether it is for Shamana or Shodhana, according to Charaga, what other Acharyas says about Pradhana Matra, Madhyama Matra, whether it is for Shodhana or Shamana, according to Acharya Charaga, there is a confusion point over there. Okay, so those have to be noted. And also, who has said Hrasyasi Matra? And what is the amount of Hrasyasi Matra? Hrasyasi Matra is said by Ashtanga Hridaya, 1 tola. Okay, 1 tola is the amount of sneha of Rasiyasi Matra, and I think 1 to 2 tola is the Matra, and 1 prahara is the time of digestion for Rasiyasi Matra. So note those things. Also, when you come to Sushruta Snehapana Kala, it is like according to Matra, he is divided into 5, right? For Sushruta. There, in addition to the indications and contraindications, you will have also have to understand the other phrases mentioned for each group. Like for example, for 3 hours, it is Chadur Bhaga Gade Ahani. Chadur Bhaga Gade Ahani means 3 hours or 1 yama, which is Alpadosha indication. Okay. Why is it Chadurbhaga Gade Ahani? You can decode it from the phrase itself. Ahani means ahas. Ahas means 12 hours. Chadurbhaga means it is divided into 4 parts where 3 hours each, right? So Chadurbhaga Gade Ahani means 3 hours has already passed for this ahas, which means the first 3 hours has passed, and you still have 9 more hours for this ahas to complete. That is what Chadurbhaga Gade Ahani. Then what will be for 9 hours? Chadurbhaga Avasheshite Ahani, which means 9 hours has already passed for this ahas, and you have 3 more hours. That is Chadurbhaga Avasheshitam. Chadurbhaga means 3 hours. Avasheshitam is left out. Chadurbhaga Avasheshite Ahani is 9 hours, and aha pranitam, which means 12 hours, and ahoratram, which means 24 hours. So these words should be noted. Okay. Coming to the 24th question. 3 months old infant having social smile, neck holding, and following objects visually. What developmental milestone most likely is to be achieved soon by him? So the options are rolling over, monosyllables, grasping object, and crawling. So the given option is grasping object. That is the right answer. You have to go through the milestones. A little bit, you know, hectic it is, or it is a little bit hard to memorize all those months and years in the order itself. But if you have small kids at home, or if you are a parent, then most of the things you might be getting. Otherwise, do connect with some codes and try to remember all those milestones. And 25, Kshana Banguravada is the doctrine of which philosopher? Answer is Buddha. It is a very much direct question. Kshanika Vijnana or Kshana Banguravada? Propounder is Buddha. And 26th question. 26th question. It is actually very easy, but at that point of time during the exam, it would be very tiresome to understand this question. So let's, break it up and learn it. Which of the following tabular interpretation by tunic fork tests is correct in case of a left-sided moderate-sized tympanic membrane drive perforation? So to start with, tympanic membrane perforation leads to deafness. I hope you all know that. And deafness is broadly classified into two. One might be conductive, and the next one is sensory neural. Okay. Two main types of deafness is conductive deafness and sensory neural. As the name indicates, you can understand that conductive deafness means there is a problem in the air conduction system, which includes the external and the middle ear. Okay. Sensory neural deafness means there is some nerve involvement, right, which accounts to the inner ear pathology. So I think this is clear for you. Okay. Now, mainly the tests done for assessment of deafness are Rennie's test, Weber's test, and absolute bone conduction test or ABC test. Okay, Rennie's, Weber's, and ABC. Those are the tests given here. So, what is Rennie's test? And you need to know what these tests are when these tests become positive to answer this question. Let's come to Rennie's test. You have a tuning fork which is of 512 hertz. In UG, your Shalakya posting, you might have seen these. You might have done these tests actually. So, Rennie's test means the vibrating tuning fork is placed vertically 2 centimeters away from your external auditory meatus to measure the air conduction. Basically, in Rennie's test, what we do is we compare the air conduction of one ear with the bone conduction and see which is better. Okay, so the basic idea is if you have a conductive deafness, air conduction will be poor. If you have a sensory neural conduction, deafness, bone conduction will be poor. Okay, this is the basic idea. So now you vibrate the tuning fork, you keep it 2 centimeters away from your external auditory meatus, and you ask the patient to let us know, let you know when the sound disappears. And once the sound disappears, what you do, you take the tuning fork's backside foot and you keep it behind your ears in the mastoid, and you ask them to let you know which, if you can hear the vibration or how long you can hear the vibration and how far you can hear it. So this is how you conduct the test. Now coming to the result. So you vibrate the tuning fork. You first place it in front of your external auditory meatus, 2 centimeters apart, and you ask the patient to, tell you when they stop hearing the sound. Once they stop hearing the sound, you take the foot of the tuning fork and you keep it in the mastoid, and you check how long they can hear. If at all they can hear the vibration, or if they can hear, how long they can hear. This is how you test Rennie's. Now, Rennie is positive when air conduction is greater than bone conduction, which means there is a sensory neural deafness, not a conductive deafness. Okay, then Rennie's test should be positive. Is set positive when AC is greater than BC, which implies there is a sensory neural deafness, not a conductive deafness. I hope until now it is clear. So the first column should be AC greater than BC. For which ear? For the left ear, because in the question it is said left-sided moderate size tympanic membrane dry perforation. So reading the question itself, you will get tympanic membrane perforation, which means there is a conductive deafness, right? Conductive deafness. Sorry, it should be BC greater than AC. I'm sorry. So there is a conductive deafness since it is a tympanic membrane dry perforation. In that case, what happens? Your AC will be lesser than the BC, right? Conductive deafness means air conduction will be lesser. BC will be greater. Okay. So while RINI is taken, RINI test positive is AC greater than BC. Air conduction is better than bone conduction is RINI positive. So in this case, how should RINI test be? It should be negative. That is, BC should be greater than AC because you have a conductive deafness in left ear. So left ear, BC greater than AC will be the right option. We'll check the options. The first option has BC greater than AC in left ear. The second option is AC greater than BC, which means the air conduction is greater than the bone conduction. But you have a problem in tympanic membrane, so obviously you will have air conduction less than the bone conduction, right? So that way it should be wrong. So the second option you can omit because the condition should be BC greater than AC in left ear. The first option can be the answer, the third option can be the answer, and the fourth option also can be the answer according to Renee's test of left ear. For the right ear, you are not given any conditions, right? So basically, we can assume that for the right ear, it should be AC greater than BC. That is, you have a normal conduction. Okay, so AC is greater than BC, and that option is given in all the three, first, third, and fourth options. It is AC greater than BC for right ear. It might be a little confusing for you. Please, hear it again so that you'll get the idea. I'll summarize it once again. Tympanic membrane perforation causes conductive deafness so that air conduction will be lesser than the bone conduction in a tympanic membrane perforation. Okay, that point should be clear. Now, coming to Renee's test is done to compare the air conduction of an ear with its bone conduction. Okay, now the procedure, you vibrate the tuning fork, you keep it 2 centimeters apart from the external auditory meatus of the patient. You ask them whether they can hear the sound, and once they stop hearing it, you keep the foot plate of the tuning fork on the mastoid of the patient and ask them if they can hear the sound. Rennie test is taken positive when BC is less than AC, or air conduction is better than bone conduction, which means Rennie positive indicates sensory neural deafness or normal. Sensory neural deafness mostly. Okay, so Rennie positive means which one is better? Air conduction will be better and bone conduction. Okay, in this case, since it is a conductive deafness, obviously air conduction should be lesser than the bone conduction in the affected ear. So the option should have BC greater than AC in the left ear. Such options are 1, 3, and 4. With that point, you can omit option number 2. Now you have 3 options. And the right ear, they haven't said anything. So we will assume it to be normal so that AC is greater than BC. Air conduction is greater than bone conduction. Then in a normal ear or in sensory neural deafness, always the AC is greater than BC. Okay, which is a condition for Rennie negative. Now coming to Weber's test. Weber's test compares the bone conduction of 2 ears of a patient. Vibrating tuning fork is kept on the forehead or the vertex of the patient. And we will be asking how long he is hearing the sound, and once he stops hearing the sound, we'll ask towards which side the sound is concentrating more. So you vibrate the tuning fork, you keep it on the forehead or the vertex, and you ask the patient to let us know towards which side the sound of the tuning fork lateralizes more. Okay, so usually in conductive deafness means AC is lesser and BC is more, right? So BC will be greater in the affected side in conductive deafness. Bone conduction will be greater in affected side. Sensory neural deafness. If it is sensory neural deafness, the bone conduction will be greater on the normal side. Am I clear? Conductive deafness, always remember air conduction will be less. So Weber's test, when you do, if the uh, deafness is conductive, then the sound will be lateralizing more towards the affected ear. That is, BC will be greater on the affected side. If it is sensory neural deafness, obviously the bone conduction will be less in the affected ear, right? So the BC will be greater in the normal ear. That is the condition of Weber's test. Okay. Now, this will differentiate your conductive deafness and sensory neural deafness. Now, here we have a conductive deafness in the question, right? So, obviously, what should happen? BC should be greater in the left ear or the affected ear. Okay. So, the arrow should point towards the left ear. Check which option has that. First option, the arrow points to the right ear, which is wrong. Second option, we already have omitted. Third option, it points towards the right ear again. So that is also wrong. Fourth option, the arrow points towards the left ear, which is right. Okay, so this is a conductive deafness. Weber's test, conductive deafness, the sound lateralized towards the affected ear. Okay, so towards the left ear in this case. Now, moving on to the ABC test or absolute bone conduction test. This is done by comparing the bone conduction of the patient and the observer or the examiner. Okay, assuming that examiner's bone conduction or examiner's ear is perfectly normal. Okay, so we'll compare the bone conduction of the patient with ours if we are the examiners. So it is also called modified Schobach's test. It is used to measure the cochlear function. So now we are moving on to the inner ear, right? Inner ear. Inner ear is more, more related to the sensory neural deafness and not the conductive deafness. Here our case is conductive deafness. So always keep in mind that this case is of conductive deafness. It relates to or it has something to do with only external ear and middle ear, not the inner ear. ABC test assesses the cochlear function, which is the inner ear. Okay. So how do you do the ABC test? You vibrate the fork, tuning fork, and you keep it on the mastoid of the patient. You ask them to let us know when the sound stops. And once the sound stops, what you do, you take the tuning fork and keep it on your own mastoid and see if you can hear the vibration. So what this implies, if the tuning fork vibration is felt by the examiner, what does that mean? The patient has stopped hearing far before, right? Which means his cochlea has some impairment because the examiner can hear the sound still, even after the patient has stopped, which means the examiner's cochlea is normal while the patient's cochlea is affected. Now, if the examiner cannot hear any sound, that is, both the patient and the examiner hears the sound for the same time, then that means both of them have the same hearing power, which means the patient has a normal hearing. Okay, so this is how ABC is done. Okay, now in this case, ABC, we said it measures the cochlear function, which is the inner ear function, which has nothing to do with the conductive deafness, right? So what will be the result for this case? It might be same as the examiner. It can be taken as same as the examiner, right? So all those point towards the fourth option, and that is the answer. I hope you've got the idea of these tests. Now, read it again, hear it again. You'll get a clearer picture. The 27th botanical name of the herb Nidigdiga, which is Kandagari otherwise, Solanum suritans, Kagamaji, Solanum nigram, then Curcuma longa, What is curcuma longa? Just turmeric, right? Curcuma angustifolia. Go find out what is curcuma angustifolia. Curcuma longa, Solanum nigrum. I've told you, but still, angustifolia is a homework for you. Okay. Now, Solanum xanthocarpum or Solanum suritans, both are botanical names of Kandagari or the Digdiga, belongs to the family Solanaceae. I've given a few synonyms: Kandagari, Vyagri, Nidigdiga, Kandadushi, Dusparsha, Kuli, Dhavani, Shashtika, etc. are the synonyms. Wild eggplant is the English name. The chemical constituents are solanum, KCl, potassium chloride, solasonin, etc. So, as far as Dravyam drugs are concerned, you need to mandatorily know the botanical name, the family name, a few very popular synonyms. For most of the drugs, you might be knowing one or two synonyms. So, most popular synonyms you can just go through. And the English name also has some importance because at times, you will be asked English names against the Sanskrit names. So it is better you have an idea about the English name also. Now, chemical constituents, most of them you might get from the name itself. If you know the botanical name, family name, etc., you can deduct it from that itself. But still, there are some specific constituents for specific drugs which you might note. Then Gana, when you study Charagam Sutram, 4th chapter, Shadvirejana Shatashrutiyam, if you complete that chapter, then most of the drugs, the ganas will be easier for you. And also, see, for Kandagari, you use it for kasam, right? It is an agriya ushadam for kasam. So kasahara gana. Like that, you can correlate. Guna, like Rasavirya Vipaga, that is Rasa Panchaga, for all it is not practically possible to study for each drug, but at least have some idea with, according to the karma and all, you can, have some idea about it. And parts used is one important thing because even in this question, you have another, you have one question where Naga Keshara comes in one question, and one statement indicates this parts used. So part used is also a little bit important. Please do go through that also. Formulations, I may not insist you to study all the formulations, but a few very popular ones you can just have a read, just one time read. Now, 28th question. Chintyanna arthanna chintyate, achintyascha chintyate. According to Acharya Chakrapani, this symptom is observed in which of the following vibramsha? So, this is a little in-depth question. You cannot do anything. You can just only go through that commentary. That's it. So the commentary is Charagam Nidanam, 7th chapter, Unmada. It is Chakrapani's commentary on that shloka. Unmadam punarmano buddhi sapnya jnana smriti bhakti shila cheshta achara vibramam vidya. You might study this quote, but in commentary they have given explanation for each one. So mano vibhrama chintya na artha na chintyate achintyascha chintyate. That is the answer. Okay, that is the question asked. So mano vibhramam is the answer. So chintya na artha na chintyate. Mano vibhramam means your thoughts are your thoughts are deranged. That is what mano vibhrama. Buddhi vibhramatu nityam anityam priyam apriyam. So give connections like that. You need not study the whole shloka, but then give some connections. Like buddhi vibhramat means nityam anityam. You cannot differentiate between nityam anityam, hitam, priya, apriyam and all. Then sapnya jnana. Sapnya means, Satya means nouns, right? In Hindi also it is noun. In Sanskrit also Satya namam or names. It comes like that. Tat vibramat agnyadi daham na buddhyate. Agnyadi daham. That is, you forget the facts. That is what Satya Jnanam. You forget the facts. Okay. Then bhaktir icha. Bhakti means in Sanskrit it is interest, right? So something you were interested about before, when you have a bhakti vibhramam, you lose interest in those things. That is how you need to understand it. Then Sheela Vibhramat Akrodena Krodano Bhavati. Sheelam means your habit. So you were not habitual to become, you won't get angrier easily early. But when you have a Sheela Vibhrama, what happens? That quality of yours, that Sheela or the habit of yours changes. So connect it like that. Cheshta Vibhramat Anujita Cheshta. That's easier, right? You need not have any connections for that. It is very easy. Now, 29. Anatmavantaha Pashuvat Bhunjate Ye Apramantaha. It is set for Ajirna, right? So that quote should be studied. As far as Ajirna is concerned, the types are very important. According to Sushruta, according to Kashyapa, according to Madhavadana, all these types are very important. Okay. And also the Samanya Lakshana has, very peculiar lakshanas, like Vibandha is present. Then Adipravritti becomes, for Adisara also you can see Purva Rupa, you'll have Vibandha, and then Rupa it becomes Adipravritti. Here, Ajirna, you may either have Vibandha or you may have Adipravritti. Okay, Maruta, Modana, all these you can relate with your personal experience. Everybody might have got this Ajirna one or the other time in your life, right? So you can relate it with that. So most of the things, the small diseases like this, which you have personally experienced, you can relate it with your personal experience so that you don't forget it. Okay, then Nidana is one important, confusion in Ajirna, specifically like Ambu related Nidanas, Atyambu Panat. Similar Ambu related Nidanas are mentioned in many topics. Try to, identify those, compile it and write it in a confusion book. Okay, Atyambu Panat. Um, then Samanya Lakshana is important. This quote is very important. And then the treatment part, different treatment options given by Sushruta and Kashyapa. That is very important. You have to note it down, study it. Okay. Now, the next question is Nityam Manda Jwaro Rukshaha Shunagastena Sidati. It is a very direct question. It indicates Vadavalasaka Jwaram. When you study about Vadavalasaka Jwaram, do read about, Pachimana Jwaram, Pralepaga Jwaram, a few types, Vama Jwaram, right? All those Jwaras, they are, Rupa or clinical features. And also this Jwara Mukta Lakshana, Jwara Moksha Lakshana. When you say Jwara Mukta, Jwara Moksha Lakshana, you have Unmada Moksha Lakshana, Adisara Mukta Lakshana, right? All those things you can compile and write in your confusion book so that you get it together. Okay. This is how you write your confusion book. Now, 31st question. Which dosha is predominant in Kardama Visarpa? Kardama Visarpa, Pitta Kapha predominant. Agni Visarpa is Vada Pitta predominant. And Granthi Visarpa is Vada Kapha predominant. Okay, that was a direct question. Types and dosha predominance of each disease is very important. I'm reiterating it. Do write the types, do write the dosha predominance of each KC disease separately. Have it handy. You might find it very useful in the last minute preparations. Okay. According to Sharangadara, Suryavarta Rasa is indicated in Shvasa. As far as yogas are concerned, you cannot, keep studying all the yogas. It is very, very difficult to study so many yogas. It is better, you have an idea about those yogas that has been, asked in previous year question papers, and a few yogas that are very popular. Then 33rd question, Kleba Vandya Adi Vruddhanapi Virya Prajapratam is said in which context? It is Lashunagrita of Kashyapa Samhita, Kalpasthanam. So this is another yoga. Nothing, but you have to go through the yoga. Kashyapa, Kalpasthana, Lashunagrita. The method of preparation, 100 pala of Lashuna is used with 5 drona of water. You make a decoction until 1 drona remains. Then it should be mixed with 1 Athaga Grita. And this 1 Athaga milk should be poured, and then when you cook in the middle of this 100 pala of crushed, peeled, lashuna. And along with that, Deepana, Jeevana, and Vrishya drugs are added, and one Ataka Dashamula is added. So this is a method of preparation. Just note that 100 pala of lashuna is used, and one Ataka Grita, one Ataka milk is used. Okay. And 100 pala of lashuna is also crushed and peeled and then used in it. Along with this, you have to remember the mode of administration. It is given as pana and bhojya. With what anupana? Madhu and shakkara. These are the important points. Also, it is the oil made with this method. You make it as an oil and it can be used as vasti. Okay. The preparation was set for grita. If you make it as oil, then you can use it as vasti. When it is grita, it is for pana and bhojya. And then you can also note down the indications of this grita. Okay. Then 34. What is the length of the Brihat Panchamula Kand taken for the preparation of Deepika Tailam in the context of Karna Shula Chikilsa as outlined in Sushruta Samhita? So the Deepika Tailam, the context itself, you have the answer. It is 18 Angula. That was a direct question. You can check Karna Rogas in Shalagim 2. Then match the list. Schedule E, Schedule T, first schedule, second schedule of Drug and Cosmetic Acts. One important area of Bhaishajakalpana. You will have to, study all those schedules. Okay. Schedule H is for prescription drugs. Schedule R is for condoms and rubber latex drugs. Likewise, you have a lot of schedules which you have to be acquainted with. While studying that, also do have a note of the years of Drug and Cosmetic Act, Drug and Cosmetic Rule, Magic Remedies Act, all these acts, rules and all. You'll have to take note of the years because in 2025, you had 2 questions concentrated on years and dates. Okay. Now see, Schedule G is for drugs that are to be taken under medical supervision. Schedule H is for prescription drugs. You can connect it as his prescription or her prescription. So that H prescription. Then R, it is for rubber latex and other mechanical contraceptives. So rubber R, you can connect it that way. R1 is for medical devices, while S is for cosmetics. V is for patent or proprietary medicine. So you find out a patent, you get a patent, or you make a proprietary medicine. You say victory, right? V. Then Schedule X is for psychotropic drugs. X something danger, right? Psychotropic, connected that way. Y. So it is for the requirements and guidelines for clinical trials. So you can ask why clinical trials. So why clinical trials? You can relate it that way. Also, you need to keep note of the years. And another important thing is Schedule E1, where you have those Upavishas, drugs mentioned in Ayurveda. Okay. Then 36. Acharya Charaga, according to Acharya Charaga, which rasa is Sarva Rasa Pratyayanika? It is Lavana Rasa. Charagam Sutram, 26th chapter, Athreya Bhadragapiyam is very, very important. Each and every shloka, every line of that chapter is very, very important. Do not leave any of those. Then 37, given below are 2 statements. Speaking about Athreya Bhadragapiyam, I left one thing to tell you, that you have a lot of points to be written in confusion book regarding that chapter. The first point itself is number of rasas according to different acharyas, right? That is one big confusion point. When you take note of number of rasas, you also have to take note of the reasons mentioned by the acharyas for that particular number of rasas, and the refuting sentence or the refuting statement of Athreya. Okay, the the whole conversation goes like one acharya will say there is only one rasa, and he will give a reason for that, and Atreya acharya will refute it by saying another reason. Okay, so all these three things should be thorough with you. Okay, because assertion reason kind of questions can be uh, asked from those. Now, the next part will be, six rasas, uh, six types of rasas, right? So those also have a lot of, confusion points. For each rasa, you might have confusion points, atyubyoga of rasa, characteristic features of rasa, all these have a lot of, confusion points. So do take note of it. Okay. That is a single acharya, Charaka Acharya himself says, similar characteristic features for different races and different characteristic features looking similar for different races. So all those you will have to note it down. Now, 37. Statement 1 says, in a 2-year-old male patient with prolapsing polypoidal soft mass of left nasal cavity, a diagnosis of anterior ethmoidal polyp can be safely made without much investigation. See, anterior ethmoidal polyp. You know what? Polyps are not so common in children below 10 years. Okay. Usually, you don't find ethmoidal, or for that matter, any polyp in children below 10 years. So, here it is mentioned a 2-year-old child, right? So, it is, if at all you find a polyp mass in a 2-year-old, you cannot assume it to be benign without any investigation. You need to investigate more on it. Okay, because since polyps are not very common in children below 10 years. So that statement is wrong. You cannot diagnose it as anterior model polyp without any investigation. You need to go for CT or MRI. Okay. Now, the second statement, in a female patient of 24 years having unilateral severe episodic throbbing headache with associated nausea and vomiting, radiological investigation is always required to commence the treatment. So the second statement says there is a female patient. She is of 24 years having unilateral and severe episodic throbbing headache, right? So it is a classical feature of migraine, right? So this that is severe throbbing headache with associated nausea, vomiting is a classical, triad of migraine. So you can diagnose it as migraine without radiological investigations unless there are other, unusual findings. Like for example, if there is any neurological deficit, that is, you have a numbness, or they say about, unusual feelings on the skin or the nerve pathway, or it is of an older age onset. It is a little more aged person gets a, the symptoms all of a sudden, abrupt onset. Then it is progressively changing, or it is becoming more and more severe with time. Unless otherwise you find these symptoms, you can safely diagnose it as migraine without any further investigations. So the second point is also wrong, because they have said you have to, have investigations, conduct investigations before starting the treatment. So that is how these two statements went wrong. So usual treatment of migraine is done with propranolol, sumatriptan, ergotamine tartarate, etc., where it provides cranial vasodilation. And DD can be sinusitis. You can differentiate it from sinusitis pain. Even sinusitis can be a differential DD for anterior ethmoidal polyp also. Okay, so read about those conditions. Since they have been asked, you can have a small idea about those conditions. Question number 38. In which of the following chapter of Sushruta Samhita, Dhanvantaram Gritam is indicated? It is a direct question. Prameha Pedaga. do not neglect the yogas of Prameha. It is very, 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 very important. Okay. So do study all the yogas mentioned under Prameha. Whenever you study a yoga, if you are not familiar with the shlokas, uh, it is impossible to study the shloka of each and every yoga, right? So, whenever you study a yoga, especially from KC, the points you should note are the prakarana, from which prakarana the yoga belongs to. Okay, the first point. The second one, if there is any important or the any very particular indications mentioned other than the prakarana, any particular or any important indication. The anupana, okay, with what anupana has the yoga been mentioned? For yogas like Narayana Churna, Yogaraja Gugulu, you have umpteen number of anupanas which differ according to the conditions. So for each condition, what anupana that you have to know, okay, in such yogas. And the fourth point is matra, how much matra. For example, if it is for Guliga, it might be Karsha Pramanam, it might be Shana Pramanam, right? So that matra should be noted. And if there is any main ingredient specifically mentioned, that also you have to note. Okay. So these are the main points you will have to note when you study yogas. Now, as far as Prameha is concerned, all the yogas are very, very important. So please do not omit any of them. Question number 39. In which of the following disease Ashtanga Lavana is indicated by Charaka? It is indicated in Kavaja Madatya, actually, right? Ashtanga Lavana in Kavaja Madatya, while Panjamlaga Yoga is in Pittaja Madatya. So you can see by now, within this 40 questions, almost 3 or 4 yogas have been asked, right? So yogas are so important. You cannot leave them as such, but what you can do is you cannot study them also completely. So what you can do is you can try to categorize and try to compile all these important points and then learn them. One second. Okay. Question number 40. Sushruta has mentioned uh, Kala in this order. Kala is one important aspect in Sushruta Sharira. You have to, understand the order, study the order, and also very important points from the Kala. That is, where is each Kala present? Okay, what is the function of each Kala? Those are the very important points in Kala. I'm sure your notes will have highlighted points regarding that. Also, there are a few similes when Kala is mentioned. That also you should, keep in mind. Okay, because see, for example, yatha payasi sarpistu gudascha ikshorasa yatha sharireshu tadha shukram nrinam vidyat prishakvaraha. Okay, so when you might be asked for which color it is, the simile is mentioned, or is it for twak? So initially, when you study kala, it will be very easy. You will remember for which kala it is said. But when you come to that revision point of time, that is almost this time, you might have studied all things, right? Like twak, all those, for that matter, all those things. So finally, when you see it in the question paper, you will get, you might be a little baffled for which structure actually this simile has been told. So be very clear about it. Make some connections with the shlokas and the mm, structures. Question number 41. According to Acharya Sushruta, which of the following Nasa rogas associated with Ratro Visheshena Hitam Vikare? It is Nasa Parishrava. It is very much direct question. Also study the features of Deepta, Puyarakta, Apinasa, etc. As I said, Shalakya first, the regular, pattern, what we see is Shalakya 1, most of them would study. Okay. Shalakya 2 is comparatively a little lightly taken subject, right? When compared to Shalakya 1. Even Shalakya 2, even if it is lightly taken, Shiroroga, Kapalaroga, until then, everybody would be fine. Then Karnaroga, 70 to 80% of them will study Karnaroga also. Right from Nasa Roga, the percentage of mm, students studying those starts declining much. So that is because you get saturated after this, Shiroroga, Karnaroga and all. So the best method to study Shalakya is the most important thing is the dosha predominance. So as I said, make sure mm, you compile all the diseases, 3 columns, disease name, to which sthana it belongs, dosha predominance according to Sushruta, and dosha predominance according to Ashtanga Hridaya. So these, 4 points in one paper, so that uh, before every weekly exam, you can just go through it and you might not lose a question from that part. Okay. The second paper should consist of the similes. Okay. The similes or the most important, characteristic features of um, each roga. That is how you study Shalakya. Then comes the treatment part. So do not omit Nasaroga, do study it. Then 42, according to Ashtanga Hridaya, which of the following disease sleep is prohibited during night time? Vishartaha and Kantharoga, sleep is prohibited even in the night time, right? So that was a direct question. Then 43, which of the following marma are Kalantara Prana? Marma is a highly volatile, topic, uh, but very easy to study, actually. Okay, so Marma also, I wouldn't suggest you to study the whole chapter, so Shariram 6th chapter in a go. You should not do that, because when you do that, what happens is Shakha Marma, you will very well study it. Koshta, okay. And when it comes to Prishta Vamsha, it'll completely, go from your hand, and Jatrurdva is left out. Right? This is how it goes. Or backwards also, if you start from Jatrurdva, what happens? Jatrurdva, uh, you will manage to study Prishtavamsha. It very confusing. You will leave it there. You'll come to Koshta and Shaga. Maybe Koshta and Shaga will be again clear. So always what happens is any one part is completely left out when Marma is considered, right? So to avoid that, to avoid your brain getting, completely into off mode, you can do one thing. Uh, one day you learn Shakha Varma. The next day you learn Jatrudha Varma. The next day you go for Uro Koshta Varmas. And again, the fourth day you go for Prishta Vamsha. Okay. Then the fifth day, again go through Shakha Varma. This time, do not sit and study as you studied for the first day. Just keep reading, because you're not going to stop reading with the second time. Okay. Again, this cycle is going to repeat for a few weeks until you are ready with the marmas. Okay. So it'll hardly cost you 10 to 15 minutes a day. And within a month's time, you'll be very much thorough about the marmas. Okay, this is how you need to study marma. You should not go in a go, right? So while studying marma, do give importance to uh, angula pramanas, then also the dosha predominance, that is satya pranahara is agni predominant, kalantaram is agni vayu predominant, agni soma predominant, Vishallagnam is vayu predominant, right? Such points should be noted. Also the numbers, how many Satya Pranahara Marmas, how many Kalantara Pranahara Marmas, all these also should be noted. Okay, and the types for Marma, the important points you should note is the Sthana, the number, Angula Pramana, the type of Marma, whether it is Satya Pranahara, Kalantara Pranahara, or Vishallagna, or Vaikalyagara, or Ujagara, and whether it is Sandhi Marma or Asti Marma, Sira Marma, Snayu Marma, Dhamani Marma. Okay, that point also should be clear. So whenever you write the notes for Marma, or even your Drona notes will be in that manner only. So when you study, have an order and study each Marma according to that order. 44. It is Durbalagni, Samagni, Mandagni, and Shushka Dehi. So, see, certain questions you may not have seen before. Okay, this was one question for me like that. I haven't studied this. Okay, so when I wrote the exam, what happened was some option somewhere should click. Okay, so go through the options, go through both the lists, go through the options given. From there, you can pick some sort of clues. So here, Samagni, usually for Samagni, it is Dvikala Bhojana because Ayurveda insists of Dvikala Bhojana, right? So Dvikala Bhojana should be there for Samagni. So I checked which option gives you Dvikala Bhojana for Samagni. There's only one option where it is option number 1. So that should be the answer, right? For me, my logic says that is the answer. So then go through the next other options like A is 2 and C is 1, D is 4, right? Shushka Dehi, it is Drava Bhojana. Shushkam and Drava, it matches, right? So I thought, okay, it goes well. Let me check for the other two also. A Durbalagni, it is given Ega Kala Bhojanam, right? That also seems matching. It is not the other way around, right? A Durbalagni, then you have light food or Egagala Bhojanam. Then C1, Mandagni, it is Matrahina Bhojana. So all the options seemed logical for me. And I was not very sure, but for Sama Agni Dvikala Bhojana was somewhat very sure for me. And luckily, I had no other options having those two. Okay, so that is how I marked 1. So this way, in this question, there was only one option. There might be 2 options or 3 options for the same combinations. So you can omit those without those combinations so that you cut down the 4 choices to 3 or 2 choices. Okay, so the probability of getting the answer right keeps increasing. The ultimate aim for you while writing the exam is that you have to find out the answer from the 4 options given. You have your option, right option among those 4. Any one of those 4 is the answer, right? So somehow from the question, either go from the question to the answer or from the options to the question. Somehow you will have to deduct the number of options and come to the right one. Okay, then 45. Which of the following is the correct sequence of layers of placental barrier from outward to inward? This is also a question which can be answered logically, right? See the options: cytotrophoblast, endothelium of the fetal capillary wall, syncytial trophoblast, stromal tissue, basement membrane. These are the options. From these 5 options, one thing is for very sure, that endothelium, it might be the innermost layer, right? Innermost layer, endothelium. And the order asked is outward to inward, right? Outward to inward, which means the last option should be the innermost layer, which is the endothelium of the fetal capillary wall, right? So last option B, there is only one option. It is option number 2. Now you can check the order for that. The first one is syncytial trophoblast. Then obviously the next option should be cytotrophoblast. Then comes the basement membrane. Then comes the stromal tissue and then endothelium of the fetal capillary wall. The order worked out wonderfully. Okay, so the layers of placental barriers, 5. So this is how you come to, mostly such questions might have only one option with the combination working out correctly. Okay, so you can see in this picture, the innermost layer is the endothelium. Okay, endothelium. This is the fetal blood. Fetal blood. Above that, the endothelium. and then the basement membrane, the stromal tissue, the cytotrophoblast, and then the syncytial trophoblast. Okay, and then outermost is the maternal basement membrane. The syncytial trophoblast. Basement membrane separates the maternal and the fetal tissues. Next, which of the following disease is not manifested in the newborn due to bearing down efforts or pravahana made in the absence of labor pains? So, untimely pravahana, that is one important topic in Prasudi. Charaga, Sushruta, Vagbhada, Bhela, all of them have given their opinions. So you will have to, study those diseases. And while you study that, the labor process should also be studied. Okay, labor process, like how Charaga has mentioned, how the order of labor for Charaga, the order of labor for Sushruta, the order for Ashtanga Sangraha or Ashtanga Hridaya, all these for Kashyapa, all these have to be studied. And there's one important point. Vimukte Garbhanadi Prabandhe Sashuleshu Shroni Vankshana Vasti Shirasucha Pravahayet Shanaihi Shanaihi. The pain, the point where Shanaihi Pravahanam should be done, the point where Pragadam Pravahanam should be done. That is Garbha Nirgame Pragadam, Garbha Yoni Mukhe Prabhanne Gada Taram. So those shlokas are very important. Then Agala Pravahana, Badiram Mukam, Vyastahanum, Murda Bigadinam, Kasa Shwasa, Shosho Upadratam, Vigridam Va Janayati. This is what the diseases are. Ashtanga Sangraha says similar one, but adds Kubja also to the list. Okay. In 47, which of the following is not contraindicated in spring season according to Ashtanga Hridaya? So, Ridhucharya is very important. When you study Ridhucharya, it is better to compare Charaga and Ashtanga Hridaya and study. Sushruta has said Ridhucharya slightly different from Ashtanga Hridayam and Charaga method, or they go hand in hand. Charaga and Ashtanga Hridaya go hand in hand, like they have mentioned indicated rasas, contraindicated rasas, indicated procedures, contraindicated procedures, all those things. Okay, so Shruta has mentioned Rithucharya with specific, references to the characteristic features of the Ritu. The trees growing, the birds and animals found in those Ritu. Specifically, the characteristic features of the Ritu has been mentioned. But Charaga and Ashtanga Hridaya, Ridhucharya includes the Charya for the people. Okay, so it is better to compare Charaga and Ashtanga Hridaya Ridhucharya and study accordingly. So there are indicated rasas. In Hemanda, it is very cold, right? So Madhura, Tikta, Amla rasas are indicated. In Shishira, it is again even more cold. Madhura, Amla, Lavana rasas are indicated in Shishira. Same way, Vasanta, indicated rasas are Tikta, Kashaya, and Kadu, while contraindicated are Madhura and Amla. Grishma, Madhuram is contraindicated, while Amla, Lavana, Kadu are contraindicated. Indicated rasa Madhuram and contraindicated Amla, Lavana, Kadu in Grishma. Varsha, indicated rasa Amla, Lavana, and Madhura, just like Shishira. Sharad Ritu, indicated rasa Tikta, Kashaya, and Madhura. Okay. So Sharad, you can correlate with Pitta. In Sharad, you have Pitta Pragoba, right? So indicated rasas are Pitta Shamana rasas, Tikta, Kashaya, and Madhura rasas. That way you can correlate those rasas. And 48, which of the following antihypertensive drug is not safe in pregnancy? So for a previous question, I told you about the hypertensive drug classification. So here, gestational hypertension drugs which are safe in pregnancy are given. So nifedipine, methyl dopa, hydralazine, labetalol, these are some of the medications indicated in gestational hypertension. So contraindicated medicines include ACE inhibitors. ACE inhibitors means angiotensin converting enzyme inhibitors. So angiotensin receptor blockers. For example, captopril is one such medication, ACE inhibitor medication, which is contraindicated. And the answer of this question, then enalapril, which is again an angiotensin converting enzyme inhibitor. This is also contraindicated. Then losartan is an angiotensin receptor blocker, which is contraindicated. Ramipril is a medication which belongs to ACE inhibitor, which is also contraindicated. So do just have a read about those. Also, diuretics. I've already told or explained the mode of action of each group of antihypertensive medications. Now, moving on to the next question, 49. Given below are two statements. Vada Kundalika is a type of Mutraghata. According to Sushruta, Vada Kundalika is a Yapya Vrana. Both statements are true. Statement number 1, Mutraghata Chikilsa or Mutraghata, KC disease. You can get your statement from there. And statement 2 is, Kritya Akritya Vidhi of Sushruta Sutra, 23rd chapter. You have Sadhyavrana, Kritra Sadhyavrana, Suga Sadhyavrana, Kritra Sadhyavrana, Yapya Vrana, and Asadhya Vranas mentioned over there. And Vada Kundalika is one Yapya Vrana mentioned in that context. Okay, so usually we wouldn't, go dig deep into Yapya Vrana there because, if you see for Suga Sadhya, you can somewhat relate those conditions, and they are familiar conditions. For Kritra Sadhya also, there are some diseases mentioned. Among Sukha Sadhya and Kritra Sadhya, there are a few confusion points, like Jatara is mentioned in one group, while Udara is mentioned in another group. Then Prameha is mentioned in one group, but Madhumeha is mentioned in another group. So there are a few confusion points in Sushruta Sutra, 23rd chapter. You need to go through those Sukha Sadhya, Kritra Sadhya Vranas and write down the confusions. Then moving on to the Yapya Vrana, those are major diseases. Majorly, all the diseases come under Yapya Vrana, and Asadhya Vrana are, most of them are similes. So that is how Asadhya and Yapya Vrana, we, move on with those. It is impossible to study all the conditions, right? So generalizing it, we say Yapya Vrana are almost all the diseases come under Yapya Vrana, and almost all the similes come under Asadhya Vrana. But I don't know whether it is unfortunate or fortunate. In 2025, there were two questions from this particular chapter, that is from Yapya Vrana and Asadhya Vrana. Okay, so that shows the importance of that chapter. So please do go through it. It's a very small chapter. It wouldn't take much time, but it has its own importance. Okay, 50th question. Which of the following is an example of phase 2 biotransformation reactions? It is methylation is the answer. So biotransformation means the enzyme catalyzed chemical transformation of drugs within a living organism. So enzyme catalyzed chemical transformation of drugs within the living organism. It is called biotransformation. The metabolites after this biotransformation are much less lipid soluble. Hence, they are not reabsorbed from the renal tubules, and thus they are finally excreted. Okay, there are two phase reactions, phase 1 and phase 2 reactions in this biotransformation. Phase 1 reactions are the degradative reaction. That is, complex molecules degrade into smaller molecules. Phase 1 reactions include, one is oxidation, which is microsomal and non-microsomal oxidations can be there. So you need not go through, all those in detail. Just know that phase 1 reactions will have oxidations, reductions. That is, both can be microsomal and non-microsomal reductions. Then hydrolysis is a third process in phase 1. So oxidation, reduction, and hydrolysis. Each one can be microsomal or non-microsomal. Then phase 2 reactions. These are synthetic reactions and are also called conjugation reactions, which include one is conjugation. Then in conjugation, it can be microsomal or non-microsomal conjugations, and there comes methyl conjugation, glutathione conjugation, amino acid conjugation, etc. So just go through the processes alone. Be familiar with the names. Okay. So the first here the question is, which of the following is an example of phase 2 biotransformation reaction? Phase 1 has oxidation, reduction, and hydrolysis. So phase 2 methylation comes under phase 2. Question number 51. Which one of the following is not a Sleshma Nanatmaja Vigara? Another very important chapter in Chadagam Sutra, it is the Nanatmaja Vyadi, chapter number 20. Okay. And for that matter, Samanyaja Vyadi, Ashtodhariyam is also very important. Ashtodhariyam, you can get all the diseases, their types in one go. Please do refer it, and you can add on the types by other acharyas side by side, so that you get all compiled together. Now, Sleshma Nanatmaja Vigara, you have to study the number of Nanatmaja Vigaras for Vadaja, Pittaja, and Sleshmaja. And you can categorize those Vigaras, like, for Vada specifically, what all, type of rogas come. For Pitta, Daha, Paga, all those things come under Pitta. For Kapha, Upalevas, all those come under Kapha. Such way you can categorize, and more versatile diseases come under Vada, specifically those Moham, then what all types of pains and all come under Vada. So do go through that total number 80, 40, and 20, all those things you have to know. Okay. Now, question number 52. Virejyaha snehitva ado snehayukter virejanehi. This is one quote, Chikitsa Sutra, right? Mentioned about Vada Shonita. As all other diseases, so Vada Shonita is also very important in KC. Do go through the general treatment principles, Chikitsa Sutra specifically. And in Vadaraktam also, you have a lot of quotes, here and there mentioned. So those also are very important. Then what for the treatment of Vadarakta? Yes, yogas are very important in Vadarakta. Do go through that also. Then 53, Vishala Stabdhanayana, Pratadam Rodadi Kshama, Akasmadatta Hasanam. So the context, I think you might have got it now. It is Vedanadhyayam from Kashyapa or Kaumara. So that is very, very important. Most of the times, match the following questions. One match the following question you might be getting from Vedanadhyayam. And there are a few confusion points in Vedanadhyayam also, specifically Sanya related symptoms. For a lot of diseases, there are Sanya related symptoms, which can be a confusion point. Then Nishtana, Nishtanecha, Nishtanatyurasaha, that one, this Agasmad Attahasanam, Agasmad Marudanargamanam, Vahika, right? All these are confusion points. Okay. So note them down. Similar, symptoms coming in different diseases make up for the confusion point in Vedanadhyayam, and it is very important. Then specific symptoms like Vishala Stabdhanayana, you don't have for any other disease except for Ana, right? So those are, what to say, earmarked symptoms of such, specific diseases. Those are also to be noted. Now, 54th question, who could be the chairman of the Institutional Ethics Committee as per ICMR guidelines? So, Institutional Ethics Committee, now, when you all get admission this year, 2026 AIAPGT, you will all be getting the admission, and you will be, going to the colleges, and there your colleges might have an Institutional Ethics Committee. The function of this committee is to, scrutinize your thesis works, your, thesis proposals and to let you know if it is feasible, if it is ethical, if it is mm, conductable, and they will be assessing your or scrutinizing your proposals, and they will be sending it to the university or the higher part to get the approval. Okay, so every institution will have an institutional ethics committee wherein the number of members is a minimum of 7 to a maximum of 15 members should be there in the council. And the chairman of the committee should be a non-affiliated person, which means should not be a member of the institution. Okay, he or she should be a senior expert from outside the institution or outside the organization. But the member secretary would be a person nominated from the institution itself. Okay, so the other members who are mandatorily needed to make the quorum of the committee are at least one non-scientific or non-medical person or a literate layman should be there. Then a basic medical scientist should be there. A clinician should be there to analyze. A basic medical scientist means he will be or she will be scrutinizing the statistical test methods, the methodology, all those things they will be taking care of. A clinician will be there who will be taking care of the clinical aspect of your study. A legal expert will be there who will be analyzing the legal issues, the probable legal issues, with the consent, your consent forms, your patient consent forms, your information sheets, all those will be scrutinized by the legal expert, and they will let you know if there is any legal problems, impending legal problems, or whatever it is. So they will be related with the legal part. And one philosopher or ethicist who will be taking charge of the cultural aspect of your uh, works, if any. And as I said, one lay person, who is not from the medical background, they simply, get to know about your study, and they will think in a layman perspective if the study will harm or it will cause any problem to the community or something like that. Okay. Now, the next one is member secretary. This member secretary will be affiliated to the institute, or a person from the institute will be the member secretary. So this much details are enough regarding the ethics committee. The 55th question: which of the following is not caused by suppression of adovada vega according to Ashtanga Hridaya? So this is another important topic. You have it in Charaga and also in Ashtanga Hridaya. So during your UG time, if you are familiar with the Charaga, then study that and then have a comparative study with Ashtanga Hridaya. Or if you are familiar with Ashtanga Hridaya, then go through Ashtanga Hridaya first and have a comparative study with Charaga. Do not sit and study both. You'll get confused. Make one thing basic, study it thoroughly, and uh, note down the difference of opinions or the extra symptoms or the different treatment aspects mentioned for the corresponding Vegas in the other Acharyas view. Okay, that is how you need to study Vegas. So all the Vegas are very important. Their treatment is very important. And the specific features, and there also you have a lot of confusion point. Like for each Vega, many Vegas, Hridaya related symptoms are mentioned. Like some have Hridroga, some have Hridaya Ubaroda, some have Hridaya Vyadha, right? So such points are to be noted in your confusion book. Okay. Now 56, Ministry of Ayush was established on. So I said dates and years have been given due importance in this paper. There are two questions where the dates have been in particularly asked. So one such question is this: Ministry of Ayush. So when you learn about Ministry of Ayush, you need to learn what was its previous name, then what to what name it was changed, what all aspects were added to it. So such things must be uh, you know read through. Okay. Now, 57, Pinasa Adhiga Vedana is outlined in textual reference of which of the following Nasa Roga according to Ashtanga Hridaya. So, again, it is Nasa Rogam, Shalakyam 2. As I said before, do make separate compilations for the dosha predominance and specific symptoms of each roga and study it. So, always remember something is better than nothing. Just by omitting one portion, you have more chance of losing marks, right? So you can learn something, from something you might be able to deduct the answer. Okay, even if it is not direct. That's what I meant. So 58, it is very much direct karma of Vada, Panchavada. Very easy question. 59, this is also yet another important portion, but very easy one, pneumoconiasis. So you have to study about this occupational health diseases. Then while you study that, do keep a note of high temperature, that is this heat cramps, hypopyrexia, stroke, heat exhaustion. The temperatures mentioned for each of these is very important. Then the particle size of pneumoconiasis, that is also very important. Do take a note of that also. And antigens for these pneumoconiosis also are important. If I'm not wrong, I think one question has come from this topic in 2024. So this topic is always, pondered for the exams. So do not skip this. Now, question number 60. Kshara karma is beneficial in Utsanna Mamsan Kadinan Rana. So you have to read the sentence and pick out the correct ones. Okay. Sivana karma is indicated in Vrana with blood inside. Kshara karma is indicated in urine excreting wound caused by Ashmari. Yavashoga and Fena are indicated for Lekana in Vrana. Avachurnana is indicated for purification of Vrana, having order and Meda Visheshan. I hope you have got the context. This Shashti Rupakramam. Shashti Rupakramam is one such topic where, most of them tend to have a loose, catch of it. Because the rest of the portions, Bhagna, Vrana, and all, we will learn, but because those are very important. But coming to Shashti Rupakrama, you will keep it for the final lab, and finally it will just vanish from the list. You won't be going through it. So what I would suggest is there are 60 upakramas, right? But you need not learn all the 60 details of all the 60 upakramas, right? So what you might do, hardly you might have 35 to 40 upakramas where you need to learn the conditions. So what you need to do is just like how you learned marma, okay, how you plan to learn marma, the same way, Shakti Upakrama, you can fix a week or 2 weeks for it. Okay. And each day learn 5 to 6 or maximum 8 karmas, their indications. Okay, connect it somehow. Learn those 5 to 8 karmas. The next day, next 5 to 8. The next day, next 5 to 8. So by 4 or 5 days, you might complete the list. Okay. Again, the next 5 days, repeat it. Again, the next 5 days, repeat it. So now the repetitions should not, take so much time as you took for the first time. Okay, first day, learn it. First round, learn it thoroughly. Second round, if you take 10 minutes or 30 minutes for first round, make it 20 minutes for second round, make it 10 minutes for third round. Okay, then on weekly once, just go through it. 5 minutes, just go through it. That is how you learn Shashti Rupakrama, and I'm sure within a month's time, Shashti Rupakrama will be in your hands. Okay, so you need not, worry about it. But if you keep it together for the last lap, I'm sorry, you wouldn't learn. Okay, so here, Kshara Karma is beneficial in Utsana Mamsam, Kadina Prana. That is correct. Utsanamamsam, Kadinam, Kandu Yuktam, Shirotidam, Dushyoda. This is the condition of Shara karma. While Sivana karma is indicated in Vrana with blood inside. So even if you didn't learn Shashti Rubakrama from Sushrutam Sutra itself, you can understand that with blood inside, you never you don't stitch a wound, right? You don't do a Sivana karma. So that should be wrong, right? Shara karma is indicated in urine excreting wound caused by Ashmari. That is also a little bit doubtful. So urine excreting wound. There is you have some sort of excretion continuously coming from there. Their Shara karma is not so effective. Instead of that, what karma can be done over there? That is what you have to think about. So actually, this both these conditions, Vrana with blood and urine excreting wound caused by Ashmari, both are indications for Agni karma. Actually, okay. So Sivana karma, you can omit it, or you can say it is wrong because with blood inside or with Shalyam inside, you never do this Sivana karma. So Kshara karma, when you have oozing continuously, Kshara, you cannot keep Kshara over there, right? With the oozing, it will flow out, right? Then how will the medicine work? So with common sense, you can easily omit that also. So B and C are to be wrong. Now, Yava, Shuga and Fena, they come under Anushastras, or right? So Lekhana, for Lekhana in Vranas. Yes, when you don't have Shastra Abhave, you use Kshaumam, Plodam, Pichu, Fenam, Yavashugam, Saindavam, Karkashapatra. So that is right. Okay, so A and D are right options. Now you can go and check your options. If you have A and D coming as correct. You have yes. First option, you have A and D correct, but C has come there. C we have omitted as wrong. So with C being wrong, you can omit 1 and 2 options already. Now you stick on to 3 and 4. B is also wrong. Sivana karma with the blood inside is not possible. So 4 is also wrong. So you can deduct your answer to 3 itself. Now, Avachurana is indicated for purification of Vrana having order and Medo vitiation. Avachurana means dusting the powder. Yes, you do it for Meda vitiation and you do it in Vranas having order, right? So A, D, and E are the correct answers. So in this way also, even if you didn't, thoroughly study, you can deduct the answers, and you can take out the options, reduce the number of options, and you can guess it also. When you guess it from 4 options, the probability is much less of getting a correct answer, but when you guess it from 2 answers, the probability is much more higher. Okay, so with this we are completing 60 questions, and today's class will be ended up here. The next session I'll be covering the next 60 questions.